And the floor is yours.
Thank you, Shelley. Welcome back to the January 27, 28, 2022 board meeting. My name is Sung-ho, president of the board. Before we convene, I would like to remind everyone again, that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This meeting is being conducted consistent with the provisions of Government Code Section 11133. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting just must join the WebEx meeting. Information and instructions are posted on our website. As I facilitate this meeting, I will announce when we're accepting public comment. I've advised the meeting moderator to allow 2 minutes to each individual providing comments. This approach is necessary to facilitate this meeting. Before we get started, I would like to ask the moderator to provide general instructions. Moderator?
Thank you. For today's meeting, we will be utilizing the WebEx question and answer feature for processing of public comments. You will hear me refer to it as the Q&A. When the president calls for public comment, I will open the Q&A session and I will display the following slide. To request public comment, you will need to locate that Q&A icon on your screen, which looks like a question mark inside of a square. It is typically located in the bottom right corner of your screen. When you click on that, it will open a text box. In that text box, you can type the word comment and submit that to our panelists. We will be taking comments in the order that they are received today. When I call your name for public comment, I will let you know that that I've sent a request to unmute your microphone. At that time, you should receive a pop-up at your end with a blue button that says unmute me. You will need to click that blue button to unmute your microphone. You may hear a brief recording from WebEx. If you do, please pause. Wait for that recording to finish before speaking. We will be having a 2-minute time limit on public comments today. I will be providing a 15-second reminder when your time is about to expire, and I will let you know when your time is expired and then remute your microphone, moving on to our next commenter. And with that, I will turn it back over to the president.
Thank you, Shelley. And Shelley, just a reminder, we have some members that may be joining in during the meeting. If you could just make sure to promote them and to just let us know. And also there may be some members that are leaving. If you could just let us know when you depart so that we can reflect that for the meeting minutes. Thank you. And I would now like to take a roll call to establish a quorum. Members, as I call your name, please remember to open your line before speaking. Maria?
Present.
Hi, good morning, Maria. Jig?
Good morning.
Good morning, Jig. Cheryl?
Good morning.
Good morning, Cheryl. Jose?
Present.
Good morning, Jose. Shirley?
Good morning.
Good morning, Shirley. Kula?
Good morning.
Hi, good morning, Kula. Again, welcome. Ricardo Sanchez? I believe Ricardo will be joining in a little bit. Nicole?
Good morning.
Good morning, Nicole. Debbie? I believe Debbie is also joining a little late. Jason Wise?
Good morning, Sung.
Good morning, Jason. We missed you yesterday, and I am here. So the quorum is been established. Okay. Moving on to the next agenda, item 10, update from the Department of Consumer Affairs. Members, I would like to welcome Carrie Holmes, Deputy Director of Board and Bureau Relations, to provide us with an updated from the department. There we go. Carrie, are you ready? The floor is yours.
Good morning, Board President O and board members. I am Carrie Holmes, Deputy Director of Board and Bureau Relations at the Department of Consumer Affairs. Thank you so much for allowing me to provide a department update to the board today. First of all, Happy New Year and thank you. DCA appreciates all board members and staff who have continued to serve through the pandemic that has affected us all in many ways. To combat the spread of COVID-19 and protect vulnerable communities, California has implemented enhanced safety measures. State employees must show proof of vaccination or be subject to regular COVID-19 testing. The California Department of Public Health is requiring masks to be worn in all indoor public settings until February 2022, regardless of vaccination status. DCA's testing program kicked off in early October at DCA headquarters and has expanded to additional sites and home testing as well. We are working together to find the right balance of staying connected and productive while keeping safe and healthy. DCA and all its boards and bureaus continue to look to the future and use lessons learned to identify long-term efficiencies and policy changes. Staff are working in the office to provide the most effective consumer protection and customer service while also utilizing telework where appropriate. DCA recognizes the difficulty of planning for future meetings as the pandemic continues to evolve. On January 5th, Governor Newsom signed an executive order that extends the sunset date set in Assembly Bill 361. Under this order, boards and committees are permitted to continue holding public meetings on WebEx without listing board member locations through March 31st, 2022. Additionally, Sacramento County issued a local order on January 6th, directing public boards, committees, and similar bodies to suspend any in-person meetings that might otherwise be held within the county and hold them remotely. After March 31st, we do expect that meetings will resume in person in accordance with all aspects of the Open Meetings Act. Before attending an in-person board meeting, members must verify full vaccination with DCA's Office of Human Resources or participate in COVID-19 testing. Board members, please don't wait until the next in-person meeting is planned. DCA requests that all members submit their vaccination verification by January 31st to allow enough time to plan COVID-19 testing for those who need it. I want to express my appreciation for the flexibility of board members and staff. We don't know what additional changes to the law may be coming, and we will keep you updated. Whether meeting remote or in person, DCA wants to help keep your board fully seated with excellent members and diverse voices. DCA's communications team recently released a new toolkit to assist boards with member recruitment, available in multiple languages. Board members can also encourage individuals to visit board member resources on DCA's homepage to apply for an appointment. As a reminder, board members have training and paperwork requirements. Each year, board members are required by law to file a Form 700 before April or face penalties from the FPPC. DCA requests that you file as soon as possible, and as a tip, I'll let you know that the best way to avoid lots of reminder emails and calls is to file early. If anyone needs assistance, DCA's filing officer and legal counsel are available to help you. Board members who are recently appointed or reappointed need to attend board member orientation training within a year of that appointment date. You can register for the BMOT through the Learning Management System, or LMS, which is DCA's training portal. Live virtual trainings will be held March 9th, June 15th, and October 12th. This is a required training for newly appointed and reappointed members, but we also encourage it for any member who would like a refresher. Board and Bureau Relations is happy to assist you with any questions you may have about BMOT or the use of the LMS. As always, Board and Bureau Relations is here to help. If there's anything I can do, please reach out. This concludes my presentation, and I'll hand it back over to Board President O.
Thank you so much, Carrie, and thank you for all the great reminders for our members and myself. Thank you. And members, do you have any questions or comments? Just a reminder, we're again starting this raise hand feature. Jason, we're going to try that out during when I have member comments. So anyone have any questions, go ahead and raise hand, and we will follow up. Okay, I don't.
Ricardo Sanchez, just let you know I'm on.
Oh, hi, Ricardo. Ricardo joined. Thank you, Ricardo. All right. Thank you, Ms. Holmes. Thank you so much again for coming, and thank you for sharing the reminders. And we're going to open for public comment before we let her go.
This is the moderator. We've opened the Q&A panel. If you'd like to make a comment on this presentation, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. Not seeing any requests. Would you like me to close the panel?
Thank you. Yes, please. Thank you so much. And Ms. Holmes, for one more thing, before I let you go, I just had a question for myself for Wednesday, March 9th. I see the BMOT. I was told that this is in person. I just want to confirm that. Carrie, sorry. You're still muted there.
Oops, I'm sorry, Board President O. No, the board member orientation training throughout this year will be a live virtual training.
Okay. Oh, it'll be live virtual. Okay.
Yes,
Got
so
it.
it will be on WebEx.
Got it. Okay. Thank you so much. We
Thank
really
you.
appreciate you. All righty.
Thank you.
Thank you, Carrie. Okay. Moving on to agenda item 11, Enforcement Committee Report. I will turn the floor over to Maria Serpa, Chairperson for the Enforcement and Compounding Committee, to provide a report on behalf of the committee. Chair Serpa, the floor is yours.
Thank you, President O. On behalf of the Enforcement and Compounding Committee, I'm pleased to report our efforts from the January 18th, 2022 committee meeting. Members of the committee are Jig Patel, our Vice Chair, Sung Oh, Ricardo Sanchez, and Debbie Veal. The first item on the agenda is discussion and consideration of disciplinary guidelines. Members, the meeting materials provide background information, including some of the relevant provisions of law. During the committee's July 2021 meeting, members requested that staff complete a review and provide recommendations for changes to the disciplinary guidelines. The proposed changes are reflected in the attachment 1. I'm hopeful that you've had a chance to review the document, and the chair's report highlights the types of changes that are being recommended. Some of them are also on the next slide. There they are. So some of the changes to highlight include updates to reflect current version and board information, and includes requirements to the disclosure of the respondent's email address. Number 2, transition to gender inclusive language. 3, updating terms to ensure consistency throughout the document and ensuring consistency with language used in pharmacy law. As an example, the word psychologist is replaced with mental health practitioner. 4, language to provide that any new licenses issued while an individual respondent remains on probation shall also be placed on probation during the specified conditions. 5, require a licensee whose license is surrendered to seek reinstatement from the board in lieu of the current process, which is seeking licensure through reapplication. 6, changes to the categories for some violations. The changes are primarily related to the scope of practice violations and violations involving sterile compounding of drug preparations, use of policies and procedures that violate pharmacy law, and repeated failure to provide patient consultation. 7, there are some new optional terms documenting some of the terms that we have added in some of our disciplinary cases. For example, there's a new optional term 41, where the individual license to include a requirement to complete the board's one-day training program on prescription drug abuse prevention and pharmacy law. Another new optional term is optional term 43 for the individual licensee and 26 for the business licensee to establish an administration fine. There's also, lastly, the new optional term 27 for the business licensees to include an optional term establishing a consultant review of business operations. 8, clarifying relevant terms relating to consultant requirement, explicitly stating the proposed consultant shall have appropriate education, training, and professional experience. Some others that are not on the slide, but I'll mention just to highlight, are 9, requiring a release, authorizing a mental health practitioner to share information if such a term is required. 10, including optional language under the posted notice of probation term to specify how such a notice should be provided. 11, where appropriate, the specific timeframes within the actions must be taken. For example, clarifying clarifying the necessary reporting requirement for notification of departure. As we reviewed this during the committee meeting, I stated I appreciated the tremendous work that was undertaken by the staff and council. They have reviewed the document in depth, and we did also in our committee meeting, and I agree with the changes as proposed. The committee discussed those changes in depth, as I said, and the meeting materials provide a summary of our discussion. Public comment was also taken, and there was a suggestion to consider the guidelines are more appropriate for a standard of care model. As I stated during the committee meeting, the disciplinary guidelines are to ensure public protection. The guidelines are included by reference in section 1760, and any changes to the guidelines must be made through the rulemaking process. The slide here displays the proposed amendments to section 1760. After discussion and consideration, the committee is offering this recommendation to the board to initiate a rulemaking to amend CCR section 1760 and the guidelines that are incorporated by reference. The full committee's recommendation is displayed on the slide, and members of the committee, before we go to general comments from board members of the committee, was there anything you'd like to add to the discussion? Okay, hearing none, how about board members? Do you have any questions or comments for us? Quiet. While the coffee kicks in, let's go to public comment.
This is the moderator. We've opened that Q&A panel. If you'd like to make a comment on the proposed changes, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. Not seeing any requests. Would you like me to close the panel?
Please do. And for the board's information, just to repeat, we did have a good discussion in the committee and public comment was taken there. So, Mr. President, that's the board's motion, and I turn it over to you to take a vote.
Thank you so much, Chair Serpa. All right, let's start with you. How do you vote?
Yes.
Okay, thank you, Jig.
Yes.
Thank you, Jig. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. Shirley?
Yes.
Thank you, Shirley. Kula?
Yes.
Thank you, Kula. Ricardo? I know you're back, Ricardo. We'll come back for you, Ricardo. Nicole?
Yes.
Thank you, Nicole. Debbie's not yet in. Jason?
Yes.
Thank you, Jason. Ricardo, are you able to talk yet, or? It's okay. We'll go for myself. I vote yes. The motion passes. Back to you, Chair Serpa.
Thank you. The next item on the agenda.
Yes, we're good.
Thank you, Ricardo.
Thank you, Ricardo.
Get that.
Gotcha. We'll mark for the record. Thank you, Ricardo. Ricardo votes yes.
Thank you. The next item on the agenda is discussion and consideration of frequently asked questions developed to discuss requirements for outsourcing facilities providing patient-specific prescriptions. Members, as you may recall, as a part of our October 2021 meeting, we discussed the implementation of several provisions contained in the Assembly Bill 1533, including provisions to allow for a California licensed outsourcing facility to dispense patient-specific prescriptions. As a part of that discussion, we noted the need to develop educational materials to assist entities with understanding the relevant provisions of pharmacy law. Members, Attachment 2 includes a copy of the draft FAQs that we considered by the committee. After discussion and consideration, we are recommending approval of the draft FAQs, and the full committee motion is on the slide. Members, do you have any questions or comments regarding the FAQs? Hearing none, I think we're ready for public comment.
This is the moderator. We've opened that Q&A panel. If you'd like to make a comment on the proposal, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. Okay, not seeing any requests. I will close the panel.
Thank you. Quiet morning for everyone. Thank you.
It is.
Thank you, Shelley. And thank you, President O. That is the committee's motion, so I turn it over to you to take a roll call vote.
Thank you so much, Chair Serpa. All right, starting with you again. How do you vote?
Yes.
Thank you, Jake.
Yes.
Thank you, Jake. Cheryl.
Yes.
Thank you, Cheryl. Jose.
Yes.
Thank you, Jose. Shirley.
Yes.
Thank you, Shirley. Kula.
Yes.
Thank you, Kula. Ricardo.
Yes.
Thank you, Ricardo. Nicole.
Yes.
Thank you, Nicole. Jason.
Yes.
Thank you, Jason. I vote yes. The motion passes for the agenda item 11B. Back to you, Chair Serpa.
Thank you. The next item on the agenda is discussion and consideration of Senate Bill 311, Compassionate Access to Medical Cannabis Act to Ryan's Law. Members, during our committee meeting, we discussed Senate Bill 311. As a part of our discussion, we noted that the measure was amended and contains several conflicts to the measure itself, as well as conflicts with the stated intent of the measure as it relates to the handling and use of patient-provided medicinal cannabis within a hospital. As included in the meeting materials, staff confirmed that the author's office intends to pursue amendments to clarify the intent of the measure as included in the letter to the Senate Journal. And members, I draw your attention to that letter and that intent. That's attachment 3. As a part of our discussion, I noted that the issue of this legislation goes well beyond the board's jurisdiction. While I understand the concerns of patients and the licensed public, there is a need for additional information on this measure. However, there appears to be no additional appropriate action by our board. The board continues to advocate for the education on the proper and safe use of medications and encourages individuals and organizations to continue to provide ongoing education on these types of topics. If there are specific legislative concerns, I would suggest that these be discussed with the author's office and, if needed, brought to the attention of the Legislation and Regulation Committee for consideration. As I note, just a couple of days ago, the California Department of Public Health released an AFL relating to this issue. AFL is All Facilities Letter. I would encourage the impacted individuals to read this AFL, as I believe it provides clarity regarding the expectations of CDPH. At this point, I believe it is appropriate for us to continue to encourage interested stakeholders to share their concerns with CDPH. On the screen there is a reference to the All Facilities Letter. If you did not receive it at your facility, there is the website there. Members, do you have any comments? Okay, I think we're ready for public comment.
This is the moderator. We've again opened that Q&A panel. If you'd like to make a comment, click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. Our first comment today comes from Danny Martinez. Danny, I've sent the request to unmute your microphone. And as a reminder, you'll have 2 minutes.
Members, can you hear me?
We can.
Okay, thank you. This is Danny Martinez with the California Pharmacists Association. So I want to clarify just the comments that I made during the committee meeting were related to when a facility chooses to house the medical marijuana in a pharmacy because they determine it is the safest, most secure place. That's when I believe that the board's jurisdiction would come into play here, because we are now talking about a licensed area that is under your jurisdiction. My comments during the committee were more, we were looking to see if perhaps the board could issue some sort of FAQ for when the facility does actually decide to house them in the pharmacy area, so that the licensees who are under the jurisdiction of the board know what to do in that case, or at least are aware of what are the the proper procedure. So I just, for the benefit of the full board, wanted to clarify those were the comments that I made during the committee on this issue. Thank you.
Thank you, Mr. Martinez.
And not seeing any additional requests for comment, I will close the panel.
Great, thank you. This item was for information only, so there is no vote. Next item on the agenda is item D, discussion and consideration of self-assessment forms. Members, each year in response to changes in pharmacy law, the board must update the various self-assessment forms. As you are aware, these forms provide licensees with an opportunity to self-assess for compliance with the provisions of pharmacy law. You may recall that the Communication and Public Education Committee is overseeing the development of an alternative way to complete the self-assessment forms. During our meeting today, we'll focus our discussion today on the recommended changes to the forms themselves and allow the Public Ed Committee to continue its separate work on the process of completing the forms. The draft versions of the updated forms are included in your package as attachment 4. To formally incorporate changes into the forms of law, rulemaking are required. As there are several rulemakings for the previous changes that are already in process to incorporate changes from prior years, today we will be a little bit more complex in our discussions. So there are previous rulemakings and changes currently going through the process. You will note that track changes include both the new changes in addition to those items that are currently under review in rulemaking. I know this can be confusing, but be assured that the track changes you see today contain all the changes from the last approved self-assessment forms. So while we'll be talking about only new information today, you will see both the new and the old visible on the form. During our committee meeting, we focused our discussion on the newly added changes only, and I believe that this approach should be followed again today. Okay, let's get started. This is the fun part. We'll start with compounding self-assessment form, which is 17M-39. This is the least complicated and a good place to start. The slide being displayed now provides the general area of amendment for this form. You will note that the newly added changes are identified with underlined text and found in sections 2.13 and 2.14. These changes include the provisions to incorporate the board's sunset bill regarding the renewal requirements and FDA requirements for compounding for interstate distribution. As a committee, we determined the proposed changes were appropriate and we'll be including this in the full motion. Well, actually, the committee's full motion is included in the meeting materials and displayed on this slide. We're going to take this in parts. So this is the first part. It's compounding self-assessment form. Members, do you have any questions or comments regarding this form? So moving forward, the committee's recommendation is our motion, and you see it on the screen. Hearing no comments from members of the board, I think we're ready for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this proposed change to this form, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. And seeing no requests, I will close the panel.
Thank you. President O, that is the motion of the committee, and I turn it over to you to take a roll call vote.
Thank you, Chair Serpa. Starting with you again. How do you
Yes.
vote? Thank you, Jake.
Yes.
Thank you, Jake. Cheryl.
Yes.
Thank you, Cheryl. Jose.
Yes.
Thank you, Jose. Shirley.
Yes.
Thank you, Shirley. Kula.
Yes.
Thank you, Kula. Ricardo.
Yes.
Thank you, Ricardo. Nicole.
Yes.
Thank you, Nicole. Debbie's not back yet. Jason.
Yes.
Thank you, Jason. And I vote yes, the motion passes. Thank you, and back to you.
Great, thank you. The next section, we're going to be covering 3 self-assessments. These 3 self-assessments are all currently undergoing rulemaking. You will note that the items are also included as a separate agenda item on this agenda, and that agenda item is number 12 and will be considered following the closing of a comment period. So we're going to address the voting on these 3 in the next agenda item. So we'll just discuss what the committee's process was. So today, for this board meeting, I will limit the discussion to just the committee's review of the newly proposed changes for the form. We'll start with the community pharmacy hospital outpatient self-assessment. Displayed on this slide includes a summary information about the recommended changes. The newly added language is displayed with a wavy line. I note that the proposed changes include technical changes as well as changes to incorporate responses to changes in regulation and legislation. The slide cross-references the sections of the form. Very small writing, but those were the sections that have those changes. As a committee, we are recommending the approval of these changes. And as indicated in the meeting materials, the committee received public comment about section 24.1 specifically, regarding ADDS used in a pharmacy that does not require an ADDS license. Staff have reviewed the issue and recommended additional changes based on this review to clarify. So that change has been included in the document that we're looking at today at the board meeting. Members, do you have any questions or comments on the proposed changes?
I apologize for the interruption. This is Anne. We did indicate what the outcome of our review was, but the change was not included in. It will be done after and consistent with the motion run through the chair for approval.
I apologize. So that's still in discussion and it's not on the hard copy that was sent out in our package. But that change as a follow-up to public comment will be made in the record. Thank you, Anne. We're going to take public comment all together on these 3. So I just wanted to remind you that as indicated on the slide, this is the committee's recommendation and it will be considered as a part of agenda item 12, where we'll be considering the self-assessment form in total. Okay, now we're going to move on to hospital self-assessment. Again, the summary of newly added changes are displayed on the slide. The committee again agreed with the recommended changes. As detailed in the meeting materials, the committee received public comment specifically to section 29.3 regarding when an ADDS self-assessment is required. Subsequent to the meeting, staff researched the issue and have confirmed that the language included in the form as presented is clear and consistent with the law and change is not appropriate. Members, do you have any questions or comments on this form? Okay, thank you. And as a reminder, we're going to be considering this form in total under agenda item 12. There are also recommended changes to the wholesaler self-assessment. The summary of the newly added changes is again displayed on the slide with reference to the specific areas of the form. The committee agreed to the recommended changes and no public comments were offered. Members, do you have any comments? And although this is the 3rd time, just to remind you, these 3 forms will be considered and voted on as a part of agenda item 12. But having reviewed these 3 items from our committee meeting, moderator, I request that you open the lines for public comment on these 3 forms. For members of the public seeking to make comments, to ensure we record your comments is clear, please ensure you reference the form and the section of the form that you are commenting on in your verbal comments. This will ensure that all of us have a clear understanding of your comments. I think we're ready for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to make a comment on the previously 3 forms mentioned, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. We have one request for comment so far from John Gray. John, I've sent the request to unmute your microphone.
Good morning. My name is John Gray. I'm a registered pharmacist with Kaiser Permanente. First, I want to thank board staff and committee chair Serpa for diligently reviewing and responding to the comments we provided during the committee meeting. I do want to revisit the question of whether an ADDS self-assessment is required for a hospital that does not hold an ADDS license but does have AUDS devices that are exempted from licensure under BPC 4427.2I. This is related to question number 29.3 of the hospital self-assessment on page 203 of the Enforcement Committee packet. The committee minutes indicate that an ADDS that is exempt from licensure under BPC 4427.2 is required to complete an ADDS self-assessment, and that the board minutes of its November 2019 meeting give the board's policy on this issue. The November 2019 full board meeting minutes in part state, the committee provided to clarify BPC 4427.7 requires a pharmacy holding an ADDS license to complete the self-assessment. Although the licensed hospital pharmacies' ADDSs are not licensed, they should also complete the self-assessment if they are to comply with all their requirements for an ADDS. Based on my reading of the November 2019 board minutes, I believe that the board's current policy has been that hospital pharmacies that operate unlicensed AUDS devices should use the ADDS self-assessment as a useful tool to ensure compliance with other requirements of Article 25 of the Business and Professions Code, but are not required to do so. Based on the provisions of BPC 4427.7a, I believe that requiring a hospital pharmacy that does not hold an ADDS license to complete the ADDS self-assessment would be inconsistent with the underlying statute and therefore the intent of the legislature. I strongly recommend that the board reconsider any change in policy on this matter. Thank you very much for the opportunity to provide comments.
Thank you, Dr. Gray.
Thank you. And not seeing any additional requests for comment, I will close the panel.
Thank you. We'll be addressing these three forms in the next agenda item. The last item that is from the committee is the last self-assessment is automated drug delivery systems. New language is reflected with double underline. Again, the slide displays a summary of the changes primarily to include technical updates, changes to incorporate changes in regulation and statute. As a committee, we discussed the proposed changes and aside from the minor clarifying language, recommend approval of the form. Also included in the meeting materials, the committee received public comment regarding the frequency with which a self-assessment must be completed. Subsequent to the meeting, staff researched the issue and are recommending changes to Regulation CCR 1715.1 to harmonize the frequency with the related statutory provision. The proposed language is displayed on the slide and included in the meeting materials. Members, I suggest we consider the committee's recommendation to approve the form first and then follow consideration of the staff language to regulation. So this slide is showing us correct. This includes the committee's recommendation on the form. Members, do you have any questions or comments to the proposed changes to the ADDS self-assessment form? As shown on the screen, this is the committee's motion, and I think we're ready for public comment.
This is the moderator. If you'd like to comment on the motion before you, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists.
Okay, I think
I will close the panel. I see none.
so. President O, I turn this over to you to take a roll call vote on the committee's motion on the self-assessment form.
Thank you, Chair Serpa. All right, we'll start with you again. How do you vote?
Yes.
Thank you, Jake.
Yes.
Thank you, Jake. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. Shirley?
Yes.
Thank you, Shirley. Kula?
Yes.
Thank you, Kula. Ricardo?
Yes.
Thank you, Ricardo. Nicole?
Yes.
Thank you, Nicole. Debbie's not yet in. I think she's almost here. Jason?
Yes.
Thank you, Jason. And I vote yes, the motion passes. Back to you.
Thank you. The last item I have to bring up is related to the proposed changes to CCR 1715.1, which will update the revision date and align the frequency with which self-assessment must be performed. Members, this was not discussed in our committee, but found after public comment, so I would entertain a motion if you think such an action is appropriate. The slide includes possible language for a motion. So we do need a motion if we're going to move forward.
I would make a motion as stated on the screen.
Thank you, Jig. Is there a second?
I'll second, Jake. This is Song.
Sung, thank you. With the motion on the floor, I think we're ready for public comment.
This is the moderator. We've opened the Q&A panel, and if you'd like to comment on this motion, please click on that Q&A icon on your screen, type comment into the text field, and submit that to our panelists.
Okay, I think we have not heard anything.
I will close the panel.
Thank you. President O, having a motion on the floor and seconded, I turn that over to you for a roll call vote.
Thank you. Starting with you again, Chair Serpa, how do you vote?
Yes.
Thank you. Jake Patel?
Yes.
Aye, thank you, Jake. Cheryl Butler?
Yes.
Thank you, Cheryl. Jose De La Paz?
Yes.
Thank you, Jose. Shirley Kim?
Yes.
Thank you, Shirley. Kula Koni?
Yes.
Thank you, Kula. Ricardo Sanchez?
Yes.
Thank you, Ricardo. Nicole Tebow?
Yes.
Thank you, Nicole. Jason Wise?
Yes.
Thank you, Jason. And I vote yes, the motion passes. Back to you.
Thank you. The last item for my section of the report is review and discussion of enforcement statistics. Attachment 5 includes enforcement statistics for the first 6 months of the fiscal year. Members, do you have any questions or comments on the statistics? Hearing none, I think we're ready for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on enforcement statistics, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. And seeing none, I will close the panel.
Thank you. President O, that concludes the report of the Enforcement and Compounding Committee. Thank you.
Thank you, Chair Serpa. Thank you for all the work you do and for all the work that your committee do. Thank you so much. We're moving on to agenda item 12, discussion and consideration as discussed in the previous agenda item. Adoption of board approved self-assessment forms, including consideration of public comments received during the 45-day comment period. As Dr. Serpa discussed during the Enforcement Committee report, the board has 3 regulations related to updating self-assessment forms that are undergoing the rulemaking process. For each of 3 self-assessment forms, community pharmacy, hospital outpatient, the hospital pharmacy, and the wholesaler dangerous drugs and devices, the 45-day comment periods recently closed. Separate from the rulemakings, the Enforcement Committee undertook review of the new proposed updates to these forms to incorporate new changes in pharmacy law. As indicated in the meeting materials, the Enforcement Committee agreed with the proposed changes. As the process is a bit confusing, I want to detail how we'll proceed. We'll consider each self-assessment form as we consider each self-assessment form. As we consider each form, we will review if comments were received. We will consider the recommendation offered by the Enforcement Committee as well. Further, we will also need to consider possible regulation language. The meeting slides will help keep us on track, and if you have any confusion on the process, we can ask DCA Counsel or Ann to guide us through this discussion as necessary. First self-assessment for our consideration is the Community Pharmacy Hospital Outpatient Self-Assessment Form. As indicated on this slide, no comments were received during the 45-day comment period. And is indicated on this next slide. Thank you. The Enforcement Committee is recommending approval of 17M-13 Community Pharmacy Self-Assessment, Hospital Outpatient Pharmacy Self-Assessment Form as proposed. This slide includes the Enforcement Committee's recommendation. I note that as part of the motion, the chair is delegated the authority to finalize a form with staff consistent with board's policy. Members, any questions or comments on the Community Pharmacy, Hospital Outpatient Pharmacy, or the committee's motion? Okay, sounds good. Moving on. Thank you. And with the committee recommendation serving as the motion, moderator, please open the line for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on the motion before you, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. Seeing no requests, I will close the panel.
Thank you so much, Shelley. All right, so having received, no public comment, I will now take a roll call vote. Members, Maria, Serpa, how do you vote?
Yes.
Thank you, Maria. Jig?
Yes.
Thank you, Jig. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. Shirley?
Yes.
Thank you, Shirley. Kula?
Yes.
Thank you, Kula. Ricardo?
Yes.
Thank you, Ricardo. Nicole?
Yes.
Thank you, Nicole. Jason?
Yes.
Thank you, Jason. And I vote yes, the motion passes. Okay, so we will now consider the hospital pharmacy self-assessment form. Members, as indicated in the meeting materials and on the slide, comments were received on the hospital pharmacy self-assessment form during the 45-day comment period. As indicated in the meeting materials, it was determined that the comments received were outside the scope of the regulation as the comments were specific to the compounding self-assessment. I agree with the staff's recommendation and response and would appreciate other members' thoughts. And as indicated on the next slide, the Enforcement Committee is recommending approval of 17M-14 as proposed. The slide includes the Enforcement Committee's recommendation. And I note that as part of the motion, the chair is also delegated the authority to finalize a form with staff consistent with board's policy. Members, any comments or questions on the hospital pharmacy or the committee's motion? Okay, I don't see any hands raised, so we're moving on to the moderator. Please open the line for public comments.
This is the moderator. Our Q&A panel is open. If you'd like to comment on this motion, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. And seeing none, I will close the panel.
Thank you. Thank you, Shelley. Okay. Now, with the public comment received, we will take a roll call vote. Maria, how do you vote?
Yes.
Thank you, Maria. Jig?
Yes.
Thank you, Jig. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. Shirley?
Yes.
Thank you, Shirley. Kula?
Yes.
Thank you, Kula. Ricardo?
Yes.
Thank you, Ricardo. Nicole?
Yes.
Thank you, Nicole. Debbie's still not yet in. Jason?
Yes.
Thank you, Jason. And I vote yes, the motion passes. Okay, so the community pharmacy self-assessment 17M-13 and the hospital self-assessment 17M-14 are both incorporated by reference in section 1715. Board staff are recommending changes to CCR section 1715 to reflect the updated versions of the self-assessment forms consistent with the votes we just took. The language is displayed on the slide. Displayed on this slide is a possible motion that can be used to facilitate the changes as proposed in section 1715. And before I want to move on, I want to make sure with Ann Sodogran and Eileen that this is separate from the motion we just voted at the end of the enforcement committee.
Yes, it is, President O. The motion at the end of the enforcement committee was specific to the ads self-assessment form and that section of the law, 1715.1. This is proposing amendment to section 1715 and the forms incorporated by reference, which are the community and the hospital self-assessment forms.
Thank you so much. Perfect. I just wanted to make sure because it's really getting complicated here. And I appreciate any comments. And also for this one, we do need a motion to move forward if members are agreeable. So anyone willing to make a motion?
Hi, this is Jay. I'll make a motion as stated on
Thank you,
the screen.
Jig. Thank you so much, Jig. Anyone willing to second for Jig's motion?
I'll second his motion.
Thank you, Jose. Appreciate that. All right. Any other member comments before we move on to public comment? Okay, thank you. Moderator, please open the lines for public comment on the motion.
This is the moderator. Our Q&A panel is open. If you'd like to comment on this motion, please click on that Q&A icon, type comment into the text field, and submit that to our panelists. And seeing none, I will close the panel.
Thank you so much. And with the public comment and the motion and the second, we will take a roll call vote. Maria Serpa, how do you vote?
Yes.
Thank you, Maria. Jig Patel, how do you vote?
Yes.
Thank you, Jig. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. Shirley?
Yes.
Thank you, Shirley. Kula?
Yes.
Thank you, Kula. Ricardo?
I vote yes.
Thank you, Ricardo. Nicole?
Yes.
Thank you, Nicole. And I think Debbie is back. Hi, Debbie. I see you. Are you able to talk? Okay.
Have I been promoted yet?
You are. There you are.
Yes. I'm a board member again.
Yay. Welcome in. Jason?
Yes. Welcome back, Debbie.
Thank you, Jason. All right, I vote yes, the motion passes. All right, so that is it. And moving on to the final self-assessment relates to the wholesaler dangerous drugs and devices self-assessment. As indicated in the meeting materials and slide, no comments were received during the 45-day comment period. As included in the meeting materials, the enforcement committee reviewed proposed changes to the wholesaler self-assessment form 1784. Are there any comments on the wholesaler self-assessment? Okay, hearing none, I believe it is time for us to consider the enforcement committee. Oh, Debbie, go ahead.
I was just going to make a motion as is presented on the slide.
Thank you, Debbie. I think this one we are okay. I believe
this is
this
coming
one
from the committee. Got it. Okay.
Yes, I believe. Next one, hopefully, if you can, Debbie. And with that, any other comments? Okay, with the committee's recommendation serving as the motion, I will ask if we can open for public comment.
This is the moderator. Our Q&A panel is open. Click on that Q&A icon and type comment into the text field, submitting that to our panelists if you'd like to make a comment. Seeing none, I will close the panel.
Thank you. Okay, with the motion and public comment, we're going to go for the vote. Maria Serpa, how do you vote?
Yes.
Thank you, Maria. Jig?
Yes.
Thank you, Jig. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. Shirley?
Yes.
Thank you, Shirley. Kula?
Yes.
Thank you. Thank you, Kula. Ricardo? Ricardo?
Yes, can you hear me?
Oh, yeah, we can. Thank you, Ricardo. I heard yes. Nicole?
Yes.
Thank you, Nicole. Debbie?
Yes.
Thank you, Debbie. Jason?
Yes.
Thank you, Jason. And I vote yes. The motion passes. I just noticed everyone's here. Yay. The board staff are recommending changes to section 1784 to reflect the updated versions of the self-assessment form consistent with the votes we just took. The language is displayed on the slide. Displayed on this next slide is a possible motion that can be used to facilitate the changes as proposed in section 1784. I would appreciate your comments and would entertain a motion if you believe such action is appropriate. Anyone willing to make a motion? Debbie, do you want to make a motion? Thank you. Go ahead, Debbie.
Thank you. I'm new at this, you know. I would like to make the motion as presented on this slide.
Thank you so much,
And I think
Debbie.
is it actually multiple slides here, but oh no, it's on one slide. Okay, as presented on the slide.
Thank you. Anyone willing to second for Debbie?
I'll second. This is Jig.
Thank you, Jake. Appreciate it. Okay, with a motion and second on, and we're going to go for public comment. Moderator, please open the line.
This is the moderator. Our Q&A panel is again open. If you'd like to comment on this motion, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. And seeing no requests, I will close the panel.
Thank you, Shelley. All right, the last vote for this very complicated process. Okay, Maria, how do you vote?
Yes.
Thank you, Maria. Jake?
Yes.
Thank you, Jake. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. Shirley?
Yes.
Thank you, Shirley. Kula?
Yes.
Thank you, Kula. Ricardo? Ricardo? We'll come back for you. Oh, there you go. You vote yes. Okay, Nicole?
Yes.
Thank you, Nicole. Debbie?
Yes.
Jason?
Yes.
Okay, and I vote yes, the motion passes. Thank you. All right. So we are moving on to the next agenda item 13, Licensing Committee Report. I will now turn the floor over to Debbie Veal, Chairperson for the Licensing Committee, to provide a report on behalf of the committee. Chair Veal, the floor is yours.
Thank you very much, President O. I'd just like to always remind people who are on this committee, because it is a very hardworking committee. Our president, Song O, is also my vice chair. We have Cheryl Butler, Jig Patel, and Jason Weiss round out our committee. So first agenda item is discussion and consideration of Business and Profession Codes 4071.1, the board's waiver to facilitate provisions for remote processing and consideration of possible changes in the law to establish permanent authority under specified conditions. So what we did as a committee, I'm not going to go through all the history. I'm just going to kind of go directly to exactly what we did. But the first thing we did is we decided to divide the waiver into first pharmacy and pharmacists, and then have a discussion about pharmacists, interns, and technicians. With the very first thing we wanted to do, now talking about pharmacists and pharmacies, is we wanted to first off check the box, make sure that the committee believes that it is appropriate for the board to make permanent the provisions of the waiver related to pharmacies and pharmacists. As part of that discussion, we talked about the benefits of remote processing for pharmacies and pharmacists, and how it would specifically allow pharmacists at a brick and mortar pharmacy to provide more clinical services, which we believe only enhances or is for the benefit of our consumers in California. So really kind of right down to our mandate. So once we all agreed that we should move forward, then we wanted to look at some of the safeguards that are included in the waiver that we thought was appropriate, and that we want to make sure that is included in the permanent authority. So the additional I'm tongue-tied here. The additional items or safeguards that we want to include in addition to what's already there is the pharmacy must use biometrics or something similar to ensure the identity of the pharmacist working remotely. There was a concern that when you're working remotely, how do you really know who's at that computer? And so biometric or some other sort of similar IT intervention to ensure the identity of the pharmacist working remotely. And I'll also mention, just because this also came up in our discussions, people were worried about how long they can work, and so by also knowing exactly who's on that computer, then the wage laws, and I'm not sure if that's the right term to use, but there are rules around how long people can work, and so that way we could also track that. Number two is that the PIC should be delegated with the authority to determine the use of remote processing. And this was something that came up in our prior meeting as well as this one, that we wanted to make sure that the PIC had the autonomy to just determine if this was the right thing for the pharmacy where the PIC was the pharmacist in charge. Number three, provisions limited to California licensed pharmacies, and specifically pharmacies located in California, and that the pharmacist performing the remote functions must also do so physically in California. And kind of my side note to this is, because we did receive some feedback from both people on our committee as well as stakeholders, that perhaps limiting it only to within California, and that the pharmacist literally had to be within the state when they're performing these functions, was a little limiting, especially in some of the border areas where there might be sister operations like in Nevada or across the border in Arizona, that's sharing this function. So perhaps for instance, if there's a retail store in California and they're using remote processing to kind of help offload some of the work, that perhaps the pharmacist could be just across the border, and that's where the actual pharmacist resides. And the committee, I think, was very sensitive to that, but we feel like in this case, we just need to take a baby step. Let's just get this in, and then at a later date, we felt like then we would feel more comfortable extending beyond the pharmacist performing remote functions outside California. But absolutely, they had to be, a licensed pharmacy, a California licensed pharmacy. And I think also, just as far as inspections and that kind of stuff, we felt like that's where our comfort level is. So that's why we ended up with California licensed pharmacies located in California and California licensed pharmacists located in California. The fourth thing is that we would be notified of HIPAA breaches. We understand, and if you read the material, that there are definitely some rules around if you have a HIPAA breach, what happens as a business, who you have to notify. But that doesn't necessarily, actually, I don't think it does include the Board of Pharmacy. And so we wanted to make sure that if around remote processing, there was a HIPAA breach, that we would be notified. The fifth safeguard that we wanted to make sure that we wanted to discuss is that we would allow remote processing to be performed when the pharmacy is closed, because there had been a question, should it only be during the pharmacy's open hours? And we came to the conclusion, and I believe we received favorable feedback also from the stakeholders, that was not really necessary. Part of this whole remote processing, once again, is to help in pandemic situations such as we have, but we're also looking for the future too. So it's not just pandemic situations, it's normal business practices in the future. And the offloading of work very likely would happen when the pharmacy is closed. So we made the determination that we were very comfortable with these functions being performed even when the pharmacy is closed. For the most part, we received public comment that supported our proposal. And the public comment also was in agreement that we should make permanent the authority around this to provide the flexibility for remote practice outside of California. So I think I already discussed that. That was item number 3, and why the committee felt like we're not quite ready to go there yet. And that we should also include some sort of off-site storage of records. So the committee recommendation to the board is that we recommend to the board, pursuant of a statutory proposal, because let me take one step back, is at the very beginning of the meeting, we determined based on advice of counsel that this absolutely requires a statutory proposal. So the committee recommends to the board, pursuant to a statutory proposal, that would direct our staff and president to draft a statutory proposal consistent with the provisions of the waiver and the additional items determined appropriate by the committee. In other words, items 1 through 5 that I just went through. With that, I think, let me take a breath and open it up to the board members, since we have a committee recommendation here to the board. Let me open it up to perhaps my committee members first, if there's anything I missed, and then I'll open up to non-committee members. I don't see any committee members with their hand up. So I see Maria does have her hand up, so let's just go right to you, Maria.
Thank you, Debbie. I was pleased to be in the audience during the committee's discussion and presentation of this, and it was very well done, very well thought out. I agree with the concept of moving forward and making some of the provisions of the waiver consistent with practice moving forward. My only comment is I think we need to have some serious discussion because I have strong feelings on number 3, which is the provisions are limited to California licensed pharmacies within California, and the pharmacists performing remote functions must do so within California. I think you had mentioned border and locations that are closer to borders, but also remote pharmacies, including hospitals, need to have pharmacists reviewing orders 24 hours a day for hospitalized type patients. And oftentimes those agreements are done with pharmacists in other states. So I would agree to it being a California licensed pharmacy if they are working in a pharmacy, but oftentimes these pharmacists are not working in a pharmacy. They're providing services as a pharmacist outside of a pharmacy. So I would suggest that we change the second part of that to the pharmacist performing remote function also be California licensed and not have any provision of do so within the state of California. That's my strong recommendation.
Thank you very much. And just to clarify, our proposal does not say that the pharmacist is California licensed, because if they're practicing in California, that's that's basically an assumption. But if you agree with Maria, then we would need to vote down the committee recommendation and make that change. And if we go outside of the state of California, then probably adding in that little piece about them being California licensed would be required at that point. So the next hand I saw go up was Jake Patel.
Thank you, Chair Wheel. We had a very lengthy discussions during our committee meeting last week, and I just wanted to let the rest of the board members know that having this preparation and being in law is going to enable all the pharmacies to have the logistics in place, like the laptops and everything else that you need, the VPN tunnel and secure login around HIPAA and privacy. And it will help during any other natural disasters or any pandemic. Hopefully we don't have to see one in our lifetime, but there might be a possibility that it will be ready. Also, we had a pretty robust conversation about staffing issues where there's a shortage of technicians, there's a shortage of pharmacists in a lot of pockets. And this is going to help some of these pharmacies that are not able to hire or convince a pharmacist to work in a location that could be rural, or even within metro area where it's very expensive to cross that bridge and go through that traffic and go to work. This will enable so many folks out there with various, short-term disability or any other hurdles they might be having to go to work physically, but they could dial in remotely. It's going to open up quite a bit of more folks that would be qualified and happy to continue to work. Some of them are already helping as much as they can, and it's going to increase and improve the labor force in pharmacy in general. So those are my comments, and I agree with Member Sherpa about having a licensed pharmacist logging in and not be in a licensed facility, so to speak. Because a chain pharmacy could have two pharmacies across borders, and the one or two members could be dual licensed, and they could just dial in and help some of the pharmacies in the area. So that's it.
So I think I just want to clarify here. It would still have to be a California licensed pharmacy, but it just wouldn't have to be within California. Is that what you're saying?
No, I'll give an example of a border town. Let's say, take like Lake Tahoe. If there's a pharmacy in Incline Village, which is Nevada, and if there's a pharmacy in Tahoe City, which is California, those two pharmacies could belong to the same chain, and the pharmacist working in Nevada is licensed in California, who could dial into the California store and help them get caught up. Now, this pharmacy in Incline is not registered in California, but the pharmacist working in that pharmacy is the same chain. They have ability to dial into other store and perform some task remotely. That's what I meant.
Okay. And just for clarity for the rest of the board members and the stakeholders, that's a pretty big deviation from our discussion, because our discussion in the past has been that it would be a California licensed pharmacy, a California licensed pharmacist, but that pharmacist could sit elsewhere. So, depending on where we go with this, we would need to review that, because having it not be a California licensed pharmacy is also is a deviation from what we had talked about before, because we wanted to be able to go to that pharmacy. Thank you, Jig. Nicole, you are the next hand up.
Thanks, Debbie. I just wanted to, I don't know if this applies or not, but just wanted to flag it so it's something that we could look at. I know as the state is looking at expanding telehealth, there are definitely rules about the practitioner and the patient being within the state. And so we might pharmacies may run into issues, especially around payment. I'm thinking Medi-Cal and various things if the people or the pharmacy is located out of state. So that just might be something we want to look into while we're having this discussion. That was all.
Nicole, thank you for bringing that up. But in that situation, wouldn't it be the responsibility, if we went that route and voted down what the committee recommended and added in that the pharmacist actually sat elsewhere, wouldn't that be the responsibility of the business to make sure that they're compliant with those other rules that the pharmacy and the pharmacists are sitting in California?
That's a good question. I'm not totally sure. That's why I was flagging the issue.
Okay.
This is something to look into.
Okay, thank you. And you guys, once you talk, make sure you take your hand down. Thank you. Song, you were the next one.
Yeah, so I actually, I totally hear the thoughts, but I want to make sure that we take a little bit of baby steps, and also we give flexibility. I would be quite concerned if it opens up for any pharmacist who's licensed in California. I think that I would never be able to vote for that. That to me is a enforcement concern. I don't see how. I understand the situations where it would be necessary, but I believe those are severely minor situations. Extremely small circumstances. That's up to the business to figure those situations out. I don't think that we should open it up for just those small circumstances that may arise. We have to be very conservative in our approach in maintaining the security and ensuring that patients are well taken care of. And if we open it up so broad, I am afraid that we will lose any enforcement abilities, and that could cause grave concerns. And so I just want to voice that I think we should maintain the committee recommendation for now. And I do feel strongly that we should look at those proposals later down the road. And just wanted to voice that concern here.
So can I just clarify, Song? I hear that you definitely want the pharmacist doing the remote processing to be located in California. But are you also saying that you think it should be if the pharmacist was outside, and I know this is totally not what you're saying, but if the pharmacy was outside California, it would also need to be licensed, or you just don't want to deviate at all from the committee recommendation?
Yeah, I'm maintaining California pharmacy and a California pharmacist, both. Yeah.
Gotcha.
Yeah.
Thank you. Maria, I'm gonna, your hand was up next.
Yeah, thank you. I just wanted to clarify, based on Jig's and Sung's comments. First on Jig's comments is, oftentimes these pharmacists are performing these functions are not sitting in a pharmacy. And therefore, that's why the pharmacists themselves should be California licensed, and that should be pretty emphatic somewhere. Because if they are working at home, in office, across the street or across the state, they may not be in the four walls of a pharmacy. And we need to include that in the provisions. And that's why I think a California pharmacist licensure is important. The second point that both Jig and Sung referred to was having that pharmacist actually sitting in another state. I'm still very strong about that because I do have to state this, is I'm really afraid of the unintended consequences of making this too restrictive. I think we have talked about in previous committees that this practice is very common in health systems and hospitals across the state, where they have pharmacists and contract with companies who are California licensed pharmacists out of state now. If we were to close that ability and make this regulation or legislation so limited, that would impact thousands of prescriptions that are verified per day in hospital and health systems across the state. I think you're going to hear that in public comment. So I am bringing that up now because that's why I really believe that the pharmacist should be able to practice outside of the state, and as long as they are a California licensed pharmacist and under the purview of the board. Thank you.
Thanks, Maria, for the clarification. Cheryl.
Yes. I just wanted to mention that as you did the introduction, that we're only speaking of pharmacists at this particular time. I just heard a reference to technicians, and I just want to make sure that we're only talking about pharmacists at this time. And I'm good with what the committee recommendation has been.
Yeah, Cheryl, thank you for the question and the ask. And this is specifically to pharmacists and pharmacies. So thank you. This is, and we will be talking about technicians in the next little bit. I am just looking, it appears that there are no more board member hands going up. So Ms. Moderator, if you'd be so kind as to open up a Q&A for the public so we can receive feedback from the public also.
You've got it. This is your moderator. We've opened that Q&A panel. If you'd like to make a comment on this discussion, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. Our first comment comes from Jazzy Graywall. Jazzy, I've sent a request to unmute your microphone.
Can you hear me?
We can.
Wonderful. Good morning, Chair and committee members. This is Jazzy Graywall here on behalf of UFCW Western States Council. UFCW is strongly opposed to the Board of Pharmacy seeking permanent statute changes regarding remote processing. UFCW believes remote processing should occur at licensed facilities, not unlicensed facilities or places, and a temporary waiver was issued during a pandemic and an emergency and unique circumstance, and the practice of making these waivers permanent for non-emergency circumstances is a bad precedent. If another emergency presents itself, the board can implement another waiver. Additional UFCW concerns include, and I'll try to get through these in the time allotted. First, chain community pharmacies should not be able to conduct remote processing, given that the pharmacies are not owned by licensed professionals, and the unique healthcare relationship of a corporation telling licensed professionals to meet certain profit-driven metrics. Additionally, the workforce study conducted by this board shows how overworked and overburdened current pharmacy staff are, and making pharmacists work after hours will not aid in reducing this workload and burden. And how is this board going to be able to enforce that all pharmacy laws are being complied with remotely, especially if pharmacists are out of the state? Second, unlicensed professionals should not be able to conduct remote processing. A licensed professional cannot watch and supervise an unlicensed professional working remotely, and the licensure implications are too severe. Furthermore, changing the ratio will exacerbate this issue. Lastly, UFCW would like to propose the following amendments: excluding chain pharmacies from remote processing, limit remote processing only to business hours, giving pharmacists the authority to expressly refuse remote processing responsibilities, and requiring remote processing pharmacies and licensees to register with the Board of Pharmacy for enforcement. We respectfully request that the board continue discussions on remote processing. It is premature to move forward without a fully drafted legislative proposal that has not been publicly discussed by this board, and it seems not all board members are on the same page around the concepts. These are just concept points, and the details matter to our members. Thank you for allowing me to make public comment today.
Thank you very much, Jazzy.
Thank you. Our next comment comes from John Gray. John, I've sent the request to unmute your microphone.
Good morning. My name is John Gray, and I'm a registered pharmacist with Kaiser Permanente. First, I want to thank the committee chair Veal and the members of the committee for a very productive discussion on the future of pharmacist and pharmacy technician remote work in California last week. The board's current remote processing waiver specifically excludes final product verification by remote processing. I would like to suggest that the board might wish to consider having the flexibility to allow final product verification by remote processing in the future. Specifically, there are several technological systems commonly referred to as IV workload management systems that help automate the process associated with preparing, verifying, tracking, and documenting compounded sterile products. Many of these systems use barcode technology to ensure correct product selection and digital photography to capture and track each step of the CSP preparation process. The commercially available systems means that it is possible for a pharmacist at a remote site to perform product verification of a compounded sterile product that was prepared elsewhere. A recent study published by Stephanie Jean at the University of North Carolina demonstrated that the use of an IV workload management system, there was no difference in the accuracy and safety of sterile product pharmacist checks performed remotely and those performed at the product preparation site. Additionally, during the COVID-19 public health emergency, the Iowa State Board of Pharmacy explicitly allowed for pharmacists to perform remote product verification of compounded products. Recognizing that the committee did not discuss this type of remote processing during the meeting, I'm not suggesting that bill text should allow remote product verification. However, I think it might be of benefit for the bill text to include a provision that gives the board the authority to allow remote product verification via the regulatory pathway when it is ready to do so. For example, the bill text could say something like, the board may adopt regulations establishing the conditions under which a pharmacist is permitted to conduct remote product verification of compounded sterile products for a pharmacy within the state of California that holds a sterile compounding license. Thank you very much for the opportunity to provide feedback on this important topic.
Thank you, John.
Our next comment comes from Paige Talley. Paige, I've sent the request to unmute your microphone.
With the California Council for the Advancement of Pharmacy, and we totally agree with Dr. Serpa and pharmacist Patel. I have members who are in border towns, and it's so important to have California licensed pharmacists who are across the border to help out our pharmacies. I can't stress that enough. I totally disagree with Jazzy Graywall, and I also agree with John Gray's comments. Thank you.
Thanks, Paige.
Our next comment comes from Danny Martinez. Danny, I've sent the request to unmute your microphone.
Good morning, members. Danny Martinez with the California Pharmacists Association. We would actually like to support the comments made by UFCW in relation to the after hours portion of this. We literally just spent almost the entire day yesterday talking about workforce burnout. You listen to pharmacists from Rite Aid and others who are really near tears every time they talk about their experiences. And now we're talking about perhaps letting them work after hours, right at a time when they're supposed to be relieved from their duties, heading home, relaxing, spending time with family, and instead they'll be working on their computer, doing further labor. I don't understand that part. It's not conducive to a good workforce. There's a ton of people right now in pharmacy who are leaving the profession because of that, specifically in the chain setting. It's just something that this should not be part of this proposal. As I mentioned, you've had a whole ad hoc committee dedicated to this burnout, and this is just not going to be conducive to that. Furthermore, we've also heard some members of ours fearful of if there is a sort of allowance of remote processing at home, what kind of software does that include? We know that there's been instances where there have been monitoring of employees at home by their places of employment. We're now inviting that into the home. So I would strongly urge the board to reconsider allowing this to happen after hours and for those reasons. Thank you.
Thanks, Danny.
Our next comment comes from Keith Yoshizuka. Keith, I've sent the request to unmute your microphone.
For the opportunity. This is Keith Yoshizuka for the California Society of Health System Pharmacists. We support these statements made by Dr. Serpa. What you may or may not be aware of is that there are requirements for hospitals to provide means for providing pharmacy services 24 hours a day in an acute care hospital. Because of this size of small hospitals, they may not be able to afford to hire a pharmacist 24 hours a day, 7 days a week. So hence, the burden falls on having a pharmacist on call. In that instance, it would be beneficial for the pharmacist to be able, upon that call, to be able to log in and approve an order for a patient, which is better than, not having the pharmacist review it at all. Secondly, in the exact case that was discussed earlier, where maybe it's on the border, maybe a Truckee hospital, which is a very small hospital, may have pharmacist employees that are living just across the border in Nevada, maybe 20 minutes away. So one, for the pharmacist to be able to review and approve orders remotely for a patient admitted to the hospital, say 2 o'clock in the morning, there is no pharmacy to be licensed in California. Of course, the pharmacist employee would be licensed because they normally work at that hospital. So I support the concept of having the pharmacist and not necessarily linked to a pharmacy, because there would be no pharmacy. Thank you very much for the opportunity.
Thank you, Keith.
And our next comment comes from Lindsay Gullahorn. Lindsay, I've sent the request to unmute your microphone.
Thank you. Can you hear me?
We can.
Perfect. Thanks. Hi, this is Lindsay Gullahorn with the California Retailers Association and the National Association of Chain Drugstores. And thank the board yesterday for the discussion during the workforce ad hoc committee. As I mentioned yesterday, we certainly understand the challenges that face the healthcare workforce. Our pharmacy teams, almost all sectors of the economy, are suffering from lack of available workforce. And we think that remote processing is actually one of the things that can help this. We don't see remote processing as adding extra work to pharmacists. Understand that this discussion today is related directly to pharmacists. This is something that actually could help burnout. It's not something that would be mandated on them, but it's just an opportunity at a different time to get their work done. So really appreciate the discussion last week in licensing committee, and we strongly support moving forward with some type of statutory proposal that allows pharmacy employees to participate in remote processing. Agree with board member Serpa and Patel's comments as well, and hope that we can move some type of proposal forward. Thank you.
Thank you, Lindsay, for your comments.
And our next comment comes from Mark Johnston. Mark, I've sent the request to unmute your microphones.
Thank you, members of the board. This is Mark Johnston from CVS Health. By my count, there's only 6 states that do not allow a pharmacist to work from home. So this is not a new and unusual topic. It's a topic that's been allowed for decades in most states, including California, albeit limited. This is an excellent opportunity for pharmacists to avoid burnout and to leave an environment such as retail, but to assist the environment such as retail. It's an excellent opportunity for single parents who might only be able to work after hours. It's an excellent opportunity for pharmacists that may be disabled and can't work in a typical work environment, but certainly could work from home on a computer. In summary, I am in favor of a broad allowance for pharmacists to work remotely, and I would encourage the board to process very broad allowances for our profession. We are professionals here. Thank you.
Thank you, Mark.
Our next comment comes from Lori Walmsley. Lori, I've sent the request to unmute your microphone.
Thank you, moderator. This is Lori Walmsley on behalf of Walgreens. We too are in support of a broad allowance of this and a statutory proposal. As mentioned by some of my fellow retail colleagues, Walgreens has leveraged work at home, particularly during the pandemic, as an opportunity for us to provide accommodations for individuals that have had limited childcare, those kinds of things, with a child that might be quarantined due to illness, with individuals that have had immunocompromised health conditions, as an opportunity to keep these people in the workforce, allowing them to help to continue to support community pharmacies across the country. We feel like this is an opportunity for us to leverage this as an opportunity to address some of the burnout circumstances. I heard Mr. Martinez from CPHA say that this could contribute to burnout. We use this as an opportunity for individuals to have a different environment, not as additional responsibilities for their current in-store positions. So this would be additional supplemental support for stores versus additional work for the individuals in the locations as an opportunity for a different type of work environment. So again, we are in support of a statutory proposal to allow this to be continued on a permanent basis. Thank you.
Thanks, Lori.
And with that, I think we've made it through all of our requests for comment. Would you like me to close the panel?
Yes, please.
It is closed.
Thank you. Okay, board members, we have a committee recommendation, so no motion or second is needed. President O, do you want me to do the roll call or do you want to do it?
I can do it.
Thank you.
All right, so this is the committee recommendation. I'm gonna go for the vote. Maria?
No.
Thank you, Maria. Jake?
Hold on, I'm just trying to observe this.
You wanna come back
for a new member? Sorry, can you just summarize the committee recommendation again? So it's,
yeah, let's go back to the slide before this one. So, and or
do you want me to summarize real quick?
Sure.
So what the committee has recommended is that there's a current waiver in place, and we're recommending that we make that waiver permanent and the provisions in that waiver. In addition to the provisions in that waiver, the committee thought these 5 additional items should be added to the waiver. And so, you know, I think the main one that you heard a lot of discussion about is number 3, that a number of the stakeholders felt like that particular statement was too prohibitive. So if you're not in agreement with that these 5 things as stated should be these additional conditions as stated should be used, then you should vote it down. If you think that that you're in agreement with the current waiver and these 5 things exactly as stated should be supported, then you would vote in favor of the motion from the committee. Did that help?
yeah, but what if I, because I was listening to the public comments around also number 5 and labor, you know, in terms of is this going to add additional burden? And so what if we wanted?
Yeah, so if you didn't agree, like if any of these you didn't exactly agree with, then you would
Okay.
you would vote the motion down.
Gotcha. Thank you. Thank you.
Yep. Back to you, Mr. President.
All right. Thank you, Chair Beal.
Sorry, this is Jason real
Go
quick.
ahead. Go ahead, Jason.
Let's just assume this measure were to pass as proposed. Shall this issue appear before the board again? Will it go to the legislative committee? What would be a next step? Shall the full board hear this issue again?
And I think what would happen is we're recommending the staff and president to develop the language and in our committee, and actually, Jason, I'm glad you brought this up, and Ann, you can correct me because I'm sure I'm going to say something wrong. But this actually needs to move fairly quickly if we want something to happen once the waiver expires, which expires currently 30 days after the end of the emergency. Where the board could extend that to a total of 90 days, so we could potentially add on about 60 days. But so that's why we're directing the staff. And in this case, a lot of times it's the committee chair, but in this case, we actually decided the president would be best to draft the statutory proposal. And then honestly, we would have to go find an author. But that our goal would be to take what we currently have as our waiver, along with the additional items determined by the committee, and move it forward with the president and the staff putting together language and helping us find an author. But because it's statutory, there's no guarantee what's going to come out, but that's what we'd recommend. Did I do okay on that, Ann?
Yeah, absolutely.
Point of clarification.
Yeah.
Because we do have new members and also it's about process. If we do vote this down, is there an opportunity to make another motion and perhaps look at dividing this up by licensee category? What I heard from both members and from the public is that there are concerns with the hospital licensees versus the community pharmacy licensees, and perhaps that could
Maria.
be a discussion.
Glad you brought that up. Yep. Mm-hmm.
Yep. So I think if we vote this down, there could be a motion. The motion could be, probably to make it simple, the motion could be just to change what needs to be changed. If we want to divide it up, we could make a motion to that effect also.
Yep.
But yes, I think after this, if this fails, of course, someone could make another motion.
I'm going to hold off, Debbie.
And that is correct.
Thank you, Eileen. I'm going to hold off on calling because there's still some comments. So I'm going to bring it back to you.
Okay.
Yeah,
So let me do hands. So I see Jig is the next one with his hand up.
Can we go back one slide, please? So if we vote this yes, this would be going into considerations with 1, 2, 3, 4, 5. But if we don't agree with any one of them, then we can come back and make a motion without that particular or modified.
Correct.
Correct. All right. Well, given the staffing situation that we discussed at length at our ad hoc committee yesterday, I think this is definitely helping the situation. Obviously, there are some changes we would like to make to it down the road, because I think remote processing is definitely going to alleviate a lot of these staffing situations that we have. If there are 3 pharmacists working right now in a pharmacy and one has to go home because they have to pick up kids at certain time, but after they pick up kids and they're doing homework, they can get on the laptop and help the pharmacy continue to work. That's going to reduce stress, not increase stress on the 2 that are left in the pharmacy. And the consumers are not going to be able to, they don't have to wait in the line for too long. So I see a lot of good into this remote processing. It's going to help everybody, whether it's working in the pharmacy. It's tremendously helping right now. And So those are my comments.
And Gina, I just have one question for you because Dr. Serpa just brought up that perhaps we need to divide this into hospital and community. I honestly think we should keep it together. And I think you're speaking from the point of community. Is that correct? And would you?
It's going to help everybody. I mean, I'm talking about hospital, pharmacy, or community, or any setting, independence.
Long-term care?
A long-term care, any setting, remote work processing, it's not going to hurt the boots on the ground that are working, because it's supporting. There's support coming from other pharmacists to do things they could do remotely. There are things that cannot be done remotely, like filling a prescription and providing consultation and selling the prescription. Those has to be done in the pharmacy. So this is helping the whole staffing situation. So I recommend we should keep it all together.
Thank you. Nicole, you're the next one with your hand up.
Hi, Debbie. Thanks. Yeah, I agree with what Jig was saying. I think, during the pandemic, we got to see a lot of flexibilities extended with telehealth for medical providers and other things that pharmacists, we had this waiver, but a lot of those things are going to continue past, and it would be great to pharmacists. And I think it does help our profession and does help with some of the stress. But would there be a way to put something in there? I know there was concern about that if we allow remote processing when the pharmacy is closed, that people would then be forced to work. I don't know if there's any way we can change the language or put something in there that offers like the protections to the pharmacists, that like they're not being forced to work in the middle of the night, but that it is an option kind of a thing. And I with after consideration, I agree with Maria as well about the pharmacist needing to be licensed in California, but not necessarily the pharmacy or where they're working to be in California. I think that'll help a lot with the issues around staffing. So that was my 2 cents.
Hi, this is Eileen.
Yeah, thanks. Thank you.
Can I just interrupt?
Yes, I was going to ask you to comment. Thank you.
Some of the concerns with respect to hours and the conditions that people work are covered under labor law. So they can't make you do remote processing for 16 or 18 hours a day. Adding something in is unnecessary. Those type of conditions are already covered under labor law, if that helps. And also, I just wanted to remind the board, unlike a rule where we have to finalize the language, because commenters and some of the board members had identified the need to move quickly before the legislature to see if we can find a sponsor and see if they are if they will act on this. Then we don't have to finalize the exact language. We're trying to get a broad idea about the policy direction, if any, that the board wants to go. And then somebody else had said, well, if we don't like this, can we do this? And it's like, yes, you can vote down this motion if you feel very strongly about any of those additional conditions or anything that was in the remote processing waiver. You could vote against the motion, and then we can look to try and clarify what the board's policy determination would be, if that helps.
Eileen,
that does. Thank you, Eileen.
Yeah, that was very helpful for, I think, all of us. Thank you. Nicole, you good?
Yes, all good. Thank you.
Okay. Jason, you're the next one in line with your hand up.
Thanks, Debbie. If I could just get clarification on how are licensed California pharmacists, what kind of oversight, like technically, how does the board oversee them if they're located out of state right now? We've heard, potential circumstances of someone being in Nevada, providing services to assist pharmacies that are here in California. Actually, how does the board oversee those pharmacists out of state? What happens if we have a pharmacist in Wisconsin helping out? I just see like logistical issues on enforcement and protection of California consumers. So if I could get that clarified, I think that would be helpful. And then lastly, I did support moving this issue before the full board for a vote. But I think once it comes down to voting on what the intent is to send it before the legislature, I will have to abstain. Thank you.
Thank you for that clarification so we understand, Jason. Eileen or Ann, can you answer his first question as far as a California licensed pharmacist performing these functions in a state outside of California, and what are how we would how we would handle that?
So I'll take a stab. This is Ann, and then Eileen, feel free to augment if you don't mind. So thank you, Member Wise, for the question. So in general, we will have jurisdiction over the license because they, are a licensee of ours. With respect to if there was an investigation that was required, traveling, if travel was required to the other jurisdiction, that could be a little bit of a challenge. But we do currently license like non-resident pharmacies and those kinds of things. So facilities that are outside of California that are shipping product in, and we don't typically do an inspection as part of the investigation. They more routinely are what we would call maybe like a mediated case, where we're looking through the records and assessing and handling it in that way. So I hope that that was helpful.
So Ann, can I ask you a question? How is that different than how you would monitor a remote processing pharmacist who maybe wasn't in the pharmacy but was remote that was in California? Is it really any different?
So I feel a little bit like I would probably need to work with the AG's office and counsel offline. I think that some of it would probably depend on the context of the allegations, right? So speaking in theory, if depending on the type of issue, if it was, I don't know, they missed a drug utilization review or something like that, you probably wouldn't need the computer itself that the person was working on. But I do think that there may be times when we would maybe need to actually see the actual, environment and or the equipment or something else. I think it's really hard to kind of anticipate all of the possible items that could potentially come before our inspectors to investigate. So I think it would probably depend on what that underlying allegation was that we were investigating. Eileen, please feel free to step in and save me here.
Hi, this is Eileen. I think some of the practical difficulties Ann just highlighted, there are different things I don't like to go into. If this happens, because things are facts and circumstances. But as Ann said, we do have jurisdiction over the license. But if you're talking about remote processing, say it's a pharmacist, it could be challenging for travel and they're working in a different jurisdiction. If it's tied to a California pharmacy, we also have access to the records because they're also licensed with us as well. But there could be practical difficulties trying to oversee that. But I think that's something we would probably want to work and talk with the Attorney General's office and offline with respect to how we would go about looking at that. Does that help?
Yeah, that's helpful. Thank you both.
Thank you. Let's see. Kula, you are the next one with your hand up.
Yeah, so when I first saw this, I thought, yes, of course, this all sounds great. As somebody who's been working from home for the past couple of years now, understanding the convenience. But then I was thinking about my thoughts are around labor. And I think it was a commenter, Danny, who said, that this shouldn't be part of the proposal, and how we spent all day yesterday talking about burnout. And so that was a thought. Now, I think Eileen just said, well, labor laws already take care of that. But then I know labor laws already take care of that, but we also heard from pharmacists yesterday talking about they're being, forced to say like, oh, I took my break, even though they really didn't take their break, right? And so some of that stuff. And then what also concerned me was during the public comment, we heard more from kind of like realtors, CVS Health, Walgreens, that were like, yeah, let's do this. And I wanted to also hear from pharmacists, just, being like, yes, this is a good thing for us, versus, the realtor saying this is a good thing. And so I think that's kind of where just my thought process has been. And I would have liked to hear from more pharmacists on how, that this would, if this would really truly be a good thing for them or not. So just some thoughts in my head right now.
Thank you, Kula, for your comments. Always good to hear from a different point of view. Song, you are the next one with your hand up.
Thank you. This is great discussion. As I was concerned, it's a very sensitive topic, and I just wanted to echo what Ms. Smiley was saying, that this is a very large framework we're trying to set so that we could send some sort of request for legislative proposal. This is not, we don't make laws. We are not lawmakers. So I'm hearing so much divisions, and we are clearly not having any consensus. So I am concerned about those divisions. So I would say maybe we should consider what Maria was suggesting as well, is separating it out. But maybe we need further discussion, but I don't see how that would actually resolve the differences either. So I think we need to proceed, and just keep in mind that this is a very broad legislative intent, and that legislators are open for suggestions by stakeholders.
President O.
Debbie, I'm trying to speak, and I don't know why my hand has not been recognized.
No, your hand is up. You have, and what it does is it puts it in order. So there's actually Jid is next, and then you.
So my hand's been up. That's what I'm saying. I've had my hand up, so I don't know what's going on.
There's a lot of hands up, and it puts it in order of when they put up. So I don't know if maybe you put it up and then took it down, put it up, and it shifted you.
I don't know, because I put it up a long time ago.
So thank you for your comments. Jid, since you've spoken, let me go ahead and let Cheryl jump you here a little bit in order.
Please.
And then I'll come back to you. And then Maria, your hand is up after Jid's.
Yeah, so I don't know how this is working, because I put my hand up at the beginning of the discussion. And so, but at any rate, I initially, when I said that I actually pretty much was in support with what our committee had come to the conclusion of, because we did spend a lot of time. And I know that one of my initial comments was why we have to move on this waiver when we could have extended this another 60 days, as to why we have to make this put this into law as a final law. My question on those situations where hospitals have been able to operate 24 hours, I just don't understand why whatever's been functioning or whatever's been happening, this waiver was just put in for the pandemic. I don't understand why personally it had to be something that we had to jump into if we had an extra 60 days. But now that I'm listening to other people go back on the things that they did not necessarily, even though the committee made a decision, I'm hearing that, well, even though the committee, and my committee made a decision, this is how I feel. Well, I'm wanting to say that, for example, I didn't feel like, I felt like we should just extend the waiver and discuss this, that it did not need to be final, but I got voted down and I support my committee, but I'm gonna mention that. And then the other thing is, I'm the pharmacist and not the PC. Right now, the way it reads, the pharmacist and not the PIC only needs authority to say no, they don't want to do remote processing. And as Kulu was saying, how about we listen to what pharmacists feel about this? Because at the end of the day, if the PIC says that they have to do it, does the pharmacist have the authority to say that I don't want to participate in remote processing? I just, I feel that we need to see a full proposal before we approve the board on the pharmacies sponsoring this.
Okay, thanks, Cheryl. Song, you still have your hand up, so I'm going to assume that we've talked. And then
Sorry,
Cheryl,
I forgot to bring it down. I'm sorry.
Okay. All right, no problem. And Cheryl, you can put your hand down now. Jig.
Thank you, Debbie. I just wanted to reply to what Kula's concern was, and just wanted to clarify by giving an example of a day in, let's say, a community pharmacy. If there are 4 people that are supposed to work today to take care of X amount of prescriptions, and let's say this was a fairly staffed pharmacy. If 1 or 2 people cannot make it in for the day and there's nobody else to substitute, but for whatever reason, if 1 or 2 of them are equipped with remote processing, they could help them do tasks that could be done remotely and not having them be required to be there physically. And that's going to help the other 2 that are left in the pharmacy, and it's going to bring down the stress. So it's not about stakeholders. It's not about the real estate owners or anything like that. It's in reality, it helps the 2 that are left in the pharmacy. So it reduces stress. It does not increase. And I have seen that in works where folks would not be able to come in due to one reason or the other. And then you have somebody that's ready to log into their pharmacy and help them remotely. So it's a blessing to everybody that's working in the pharmacy right now and to reduce stress. Thank you.
Thank you, Jig. Maria, you are the next one with your hand up.
Just trying to wind this up, and Ann and Eileen can step in, and actually President O also if they have any clarifications. What we're being asked as a board is to allow board staff and the chair and the president to move forward on these discussions. The details are still to be hammered out with the author and with the committee. Also, the board meeting, the board will be reviewing this many more times before this goes to vote by legislature and before anything gets implemented. I'm actually going to be, the reason I'm speaking now is because I'm changing my vote to yes, because I think that it is important that we continue the momentum and the discussion. The risk is voting no means that nothing happens and the waiver and the authorization of the waiver goes away, and a vacuum, a gap will be implemented in between the waiver and the next time we have the opportunity to make a legislative proposal. So we will have many more opportunities to talk about this. The details, I think the general concept I'm in agreement with. I don't like number 3, but I can overlook that because I know that we'll have many, many more opportunities to talk about the details. So I would encourage everyone to vote yes, just so that we can continue the conversation. If you vote no, the conversation could end today.
President I didn't know, this is Eileen. I just wanted to check because in response to Member Butler comments, I know we had a healthy discussion at the committee level about the timing and possibly the need. I don't know if the other board members who didn't participate at the committee meeting would like to have that explained.
Yes.
Why?
Yeah, Eileen, please do explain it because I think that's, I was going to touch on it, but you are much more knowledgeable. So why don't you go ahead and explain it?
All right. For the board members who did not participate at the committee, under Business and Profession Code 4062, the board has the power to waive provisions of pharmacy law during a declared emergency. Our power to waive such law will expire 90 days after the declared emergency is terminated. We don't know when the declared emergency is going to be terminated, but once that happens, the board's ability to waive law under this section, including continuing the remote processing waiver, will expire 90 days after. So there were some board members and I think public commenters who were concerned that we don't know when that will happen, and this has provided a lot of flexibility for pharmacies and pharmacists and the personnel to be able to work during a pandemic. And if the declared emergency, say, is terminated by the governor next month, then the remote processing waiver will expire 90 days after the declared emergency is done. And then to try and go in before the legislature will mean delay probably to next year or something, but I would defer to Ann on that. She's got much greater experience dealing with the timeline for statutory proposals. But does anybody have any questions about that? That's explaining why some people are concerned and are trying to move quickly.
Yeah, and Eileen, if I can just add to that, so what we discussed in committee and what we're trying to do here is and actually technically we voted to just have it 30 days after the end of the emergency, but we can extend that to 90 days. But after that happens, if we don't have legislation in place, that's why we have to get a statute in place, then remote processing is gone. And so what the committee decided that we should do is we don't want it to go away. We feel like for pharmacists and pharmacies, this is something we would like to continue. So, I understand your show. We want to, put it off. Let's wait a little bit longer to see what happens. And I think in the committee, what we decide is that's fine. And actually, even just going through the legislative process, it's still going to take time to get this in place. And so we did definitely feel like there was a sense of urgency. And that's why we needed to move forward with the statute. And then kind of my turn to speak, I'm going to say a couple things too, is I agree with Maria's approach. I think we need to just go with the committee recommendation. Because once again, what we have here, we're going to have to go find an author, and whatever the author puts in the bill is going to probably come back to us to review. This is not a one and done. This is, let's move forward with the general policy statement of the board and generally what we want. And through the legislative process, it's going to get refined and fine-tuned and changed. Honestly, possibly the things we don't like, and hopefully to mostly what we do like. But but we felt at the committee, we felt like we didn't want remote processing to go away. We felt like it had proven to be a benefit in the pandemic, and for the future of pharmacy outside the pandemic, that there was some benefit to it. So that's why the committee really wanted to kind of push this forward. Anne, I see your hand up, so I'm going to call on you next.
Thank you, Debbie. Yeah, the bill introduction deadline is I believe like February 20th. So there's not a tremendous amount of time. Typically with legislation, when the board sponsors something, depending on the language, in this case, the recommendation is that the staff will work with the president to revise the language. But once the board votes to sponsor something, I think it's might be helpful to draw the distinction between the legislative process and the regulatory process. So in the regulatory process, you as the policymaker, you drive what that language looks like and you adopt it. It's separate in the legislative process. In the legislative process, we may vote to sponsor something, but it's really then the author's bill. And depending on the author, you may, typically they're very agreeable to working with you as the sponsor, but it is a much different process and the board doesn't maintain the same level of control as it does in a regulation. So typically how the board manages that is that as established in the board member procedure manual, changes in legislation are run through the board president and ledge chair, who is President O. So if action needs to occur in between board meetings by board policy, it is established through the president to work with staff on those things. Me as the board staff person, I don't have the authority to do that. It is delegated to the board president, and so that's how you navigate the legislative process. So the board, should the board determine it appropriate to pursue this legislation, either this proposal, this current motion, or a subsequent one, whatever the case may be, staff will be working with the board president, which is both consistent with the motion as well as the board member procedure manual and delegated authority as the president to do so. So updates will be provided and members will be able to provide direction at public meetings. But from a practical standpoint, because of the legislative process, that's how the board handles those different kinds of things. If the board is successful in finding an author and securing a legislative proposal, the earliest it would take effect is January of 2023, unless there was urgency provisions. And I'm not quite sure we would reach the threshold that would be required for urgency legislation. So I hope that that's helpful context. Thank you.
Anne, I just want to highlight one of the things you just said. And you mentioned, through regulation, we can really control things. Through statute, we can't. One of the things we talked about, and maybe I didn't emphasize enough, is we cannot do this through regulation. We've had a review by council. This is not something we can do by regulation. It has to be done by statute. Is that correct? So we are going to lose some control no matter what we do. Is that a fair statement?
Debbie, this is Eileen Smiley.
Okay.
Yes, that is a fair statement. And it's also, when things go through the legislative process, everybody has a chance to comment, including people with competing interests, to deal with the labor law implications and other things.
Okay, thank you. All right, so the hands up, let me tell you the order that they came up. It was Song, then Kula, and then Cheryl. So Song, you're the next one up.
I also just want to add, as everyone knows, usually I try to make some common grounds as much as we can. I think we as board should be harmonious in trying to figure out a solution that is practical. And so I felt, just wanting to say that this actually committee recommendation was a real good compromise. And I hope that this is we can serve as a role model in trying to find a harmonious balance of all the interested stakeholders to trying to move forward into solving the issues for California consumers. So I just wanted to say that for the record. And
Thank you.
That's all I can say.
Thank you, Song. I appreciate that. Make sure you take your hand down. Kula?
Yeah, I just wanted to say thanks to Jig for that example. It was really helpful for me. And also, I think to Maria, who talked about, this is just opening up the conversation and then thinking through the legislative process. So I will be changing my vote from what was going to be a no to a yes. So just wanted to know that.
Thank you, Kula. Cheryl.
Oh, yeah, I'm sorry. I was just wondering, since Ann said February 20th, will the legislature have, is there another meeting before the end of the year? Because since the governor is not going to lift this emergency anytime soon, and 90 days is enough time for the board to respond if that happens, I would still I want to see what the language publicly with the board ensures the issues, if all the issues are addressed. But if she's saying February 20th is the last time for the year that this could be addressed?
As far as statute, as far as proposed, as far as finding an author to try to move it forward. So we have to get an author, and we have to get a bill in place by February 20th.
But all the issues that we've just like I see Maria has a problem with 3. I have a problem with 2. If the pharmacists aren't able to have any input, I would still have a problem. So that is something, in other words, that we can address in a later meeting.
So I think Eileen did a pretty good job of explaining that once it becomes a bill, we can, through Song and our staff, try to manage the bill to the best we can, but it's not like a regulation where we can dictate every word. It becomes more of a negotiation. But it will come back to the board, as through probably the reg leg.
Right.
Piece.
So
it'll come back that way.
So what would usually happen in this course, and this is an unusual situation due to the need that we felt was urgent for this provision, certain reasons. So if we succeed in finding an author, which is not really guaranteed, we will do our best. And I'm not an expert in legislative proposal. That's the California legislators. So if we are successful in finding an author, then we would still need to submit and propose certain language that will be drafted working with the author. And if that actually is successful, then this will come back for the Legislative and Regulation Committee, just like we decide if we would support or oppose any legislation, and then that would come for the full vote to see if we would support it. That would be my path that I see. And if you think that that actually may not be the case, just let me know and you can correct me.
Yeah, Sung, I think that that's spot on. It's similar to the path that we took last year with CLIA waived tests. If you remember what the board's original policy was and what the policy goal of the legislation was, and then what was enacted was slimmed down a little bit, right? So working with the board president in between and then checking back in with the board during public meetings.
Okay, Song, I see all of the hands of board comment is now down. So
all right.
Can I hand this back to you to maybe call for
all
the
right.
vote?
Thank you, Debbie. Okay, so thank you for an amazing discussion, everyone. And we're going to go for the vote for the motion that's displayed. Maria, how do you vote?
Yes.
Thank you, Maria. Jake, how do you vote?
Yes.
Thank you, Jake. Cheryl, how do you vote?
Yes.
Thank you, Cheryl. Jose, how do you vote?
I vote yes.
Thank you, Jose. Shirley, how do you vote? I believe Shirley stepped away. Kula, how do you vote?
Yes.
Thank you, Kula. Ricardo, how do you vote?
I vote yes.
Thank you, Ricardo. Nicole, how do you vote?
Yes.
Thank you, Nicole. Debbie, how do you vote?
Yes.
Thank you, Debbie. Jason, I believe you will abstain, but just to confirm.
I will abstain. Thank you, Sam.
Thank you, Jason. And I vote yes, the motion passes. Thank you. Back to you, Debbie. Thanks for great discussion and thanks for leading the discussion, Debbie.
My pleasure. Do we want to take a break? I think I need one.
Yeah, that's probably a good idea. Let's do that.
11:30, is that enough time? That'll be about 11 minutes.
Good for me. That's good for
Okay.
everyone.
Thank you.
We'll start with Maria.
Here.
Thank you, Maria. Jake, are you back?
I'm here. Thank you.
Thank you, Jake. Cheryl, are you back?
Yes.
Thank you, Cheryl. Jose, are you back?
I'm here.
Thank you, Jose. Shirley? Shirley, I think is still not back. Kula? Oh, Kula is here, but
Hula dropped off during
she
the break.
did?
I have not seen her come back yet.
Okay. Okay. It's okay. We will, if you could just keep an eye out for her. She might have already left and might be back, but we'll come back for Kula. Ricardo?
I'm here.
Thank you, Ricardo. Nicole?
I'm here.
Thank you, Nicole. Debbie?
I'm here.
Thank you, Debbie. Jason?
I'm here, Sung.
Thank you, Jason. And I am here. The quorum is here. So I'll send it back to you, Chairville.
Thank you. Okay, so once again, I echo President O comments. Appreciate that very robust discussion. We had somewhat similar, but I think the one today was even better on the pharmacists and pharmacies. So in our committee meeting, we moved on from pharmacists and pharmacies to also consider the waiver provisions related to pharmacist interns and pharmacy technicians. And we reviewed the current waiver provisions for pharmacist interns and pharmacy technicians, and then had a discussion about, did we want to basically do the same thing we just did with pharmacies and pharmacists, and that is consider establishing a policy moving forward with a, to hopefully make permanent a waiver for pharmacist interns and pharmacy technicians. The committee was split, and we also then taught, the committee was split with quite a few of the members feeling that we have this pharmacy technician summit that's going to be coming up, as well as listening sessions, and that what we do with pharmacist interns and pharmacy technicians should be part of that summit. I think the other, so that was kind of one camp of the committee. The other camp of the committee was that the pharmacist interns and pharmacy technicians would just help the pharmacists in their remote processing duties, and really is kind of part of the deal. And that's why we should move forward with extending or making permanent the waiver.
I'm so sorry to interrupt, Debbie. Could you promote Kula to the attendee list, please, moderator? Thank you. Sorry.
No, no problem. So then we went to the public, and the public supported making provisions to make the waiver permanent for the pharmacist interns and pharmacy technicians. And their comments were that there's also some comments about, how do you handle ratios, and to what extent remote supervision by pharmacists working remotely be allowed. And then there was also some comments about a number of states already allow it, so this isn't maybe anything really revolutionary. We also went through a number of studies that had occurred. Let's see, I'm looking at agenda item. Can you go back? I think, moderator, there were some. Yeah, so we did talk about specifically the NABP survey of states in 2020. So once again, it shows that 20 states actually allow technicians to provide remote processing. But at the end of the day, we took a vote, and the committee decided that our recommendation to the board is that this issue for processing pharmacy technicians should be considered as part of the Pharmacy Technician Summit, and thus we would not be taking any action at this point in time. So that is our recommendation to the board as a committee. Once again, it was not unanimous, but that as a committee, this is our recommendation. So this is our motion to the board. With that, let me take any comments. Jig, I see that you have your hand up, so please speak.
Thank you, Debbie. So, when we met for committee, we were not in agreement with this, but I just wanted to talk in front of all the board members that this is no different than a pharmacist helping with remote tasks, because a pharmacy technician can only do so many functions, and they will be able to do only those functions that could be done remotely. Same thing for intern pharmacist. So again, I don't want to repeat myself, but it has the same positive impact for boots on the ground to reduce stress and everything else. So we should have a further conversation about this, not wait until the summit, and hopefully we can have a different motion and having the pharmacy technician and intern being able to remote process also in the pipeline.
Thank you, Jig. Cheryl, you're the next up.
Yes, and I just want to mention that we will be discussing with pharmacy techs many issues as when it comes down to there's a reason why we decided on a pharmacy tech summit. And I think that this is something that we're asking pharmacy techs to do. And I think that they should be able to chime in on how they feel about this. Again, we have a waiver that's 90 days, and we still have not had the Pharmacy Technician Summit. And these are pharmacy tech issues, and I think they should be included on this. And again, we're just, it's a waiver that we had for pharmacists, and we're now pushing this through. But I think we should wait for the Pharmacy Summit, and that's why the majority of us made the decision that that's the way we should go.
Thank you, Cheryl. I want to just make a couple comments. For those who are new to the board, I refer to, as has Cheryl, the Pharmacy Technician Summit. So let me just take a breath and a minute here and explain what that is for potentially new members. Our committee, the licensing committee, has decided that we need to look at pharmacy technicians and the job functions that they're performing. And the best way to do that is to really have a summit, because there's like a million different ways we can go with it. Perhaps by practice site, perhaps by expanding some of the duties that they can do today, which are all non-discretionary, and I believe they will remain non-discretionary. But there's a couple different ways you can cut the pie. So in the very near future, we are going to have initially some listening sessions that will be via WebEx, rolling up to what we anticipate will be a face-to-face type of meeting, where we can have a discussion about how we bring all this information and how what is the best way to move forward, with a emphasis on the listening sessions and the summit. This kind of goes to something you said, Kula. The emphasis will be, we really want to hear from technicians, and honestly, we also want to hear from pharmacists also about how this all works together. So our listening sessions are focused on trying to get information. They're going to be at a variety of days. I think we threw out there maybe like 10 of them, 10 in total. But we're trying to get information from the technicians, from the pharmacists, so we can figure out how to move forward. So just because we've mentioned a couple times the Pharmacy Technicians Summit. I just wanted to be clear with that. And then I want to also make sure I'm clear that there was also a waiver for pharmacists and pharmacist interns and pharmacy technicians that's actually also in place, that's separate from the pharmacist waiver. So we would just, what this question was, is making that waiver permanent. Okay, with that, I hope that clarified things. Cheryl, you still have your hand up. I think you're done. Is that correct?
Yes, thank you, Debbie. I'll make sure my hand goes down.
Okay, I just since I had problems with your hand in the last one, I don't want to mess it up again. Okay, Nicole, you're the next one up.
Thank you, Debbie. Really good points made on both sides, and I appreciate that. What I want to raise right now, though, is as much as we're having trouble and stress and staffing issues with pharmacists, it's maybe even worse on the side of technicians now in terms of people leaving the profession, and that those shortages put a lot of stress on pharmacists when you don't have your techs. We all rely on our techs so much. You can't get anything done, without your techs. So I wonder if I'm not opposed to waiting for the summit, but I think we need to be really conscious if we move forward with the pharmacists, but not the techs, that we might be, again, sending a message to the techs that they're, one, maybe less valued, and two, that if we wait too long, we're still losing people from the profession when this might actually feel very supportive to them. So I would say that if we're going to do a summit, I would hope it would be very quickly and we wouldn't have a long delay between those two, if that makes sense.
Thanks, Nicole. Yeah, our intent, just FYI, our intent is actually to try to have the listening sessions within the next couple of months, and then the summit shortly after that. Although since we kind of want to have it face-to-face, we're tiptoeing along with when the emergency order is lifted and we can actually have face-to-face meetings. So that's kind of what we're wrestling with. But thank you very much for your comments. Song, you have your hand up and you're the next.
Thank you. Just wanted to also comment that I hear those thoughts and I really understand and respect, but traditionally and historically, the laws and the regulations involving pharmacy technicians in California is a lot more complex and a lot more restrictive. And so that's why it is really not a simple situation. I mean, nothing is simple, but I just wanted to make a note of that. And the reason why I felt that this needed to be discussed further is because of those complexities, the laws regarding technician duties and supervision and the ratio. So much things are very, very, very complex. So that's why we felt that this was, some of us in the committee felt that this is the right way to go, but understand those thoughts for sure.
Thank you, Song. Cheryl, it looks like you have another comment.
I just wanted to just chime in on what Nicole said and just say to Nicole, I think this helps the text, Nicole, because like you said, there is a shortage, but this is a way for us to hear from the technicians, and this may help the shortage. For as I'm concerned, is having them have their input as to, what their duties are. And we may not have a shortage if we give them a chance to have something to say about what they do and what they don't do. Thank you.
And Cheryl, I just want to clarify, you're talking about the Technician Summit, correct?
Absolutely.
Okay,
Thank you.
Thank you. Jig, I see your hand up.
I was just trying to put it down. I couldn't figure out the button, sorry.
Okay, no problem. So my thought about this is that I think it goes hand in glove, the pharmacist interns and the pharmacy technician remote waiver. And so I personally think that this is something that we should make permanent. And kind of along with what Jig said, is I see what the technicians and the interns doing basically is administrative type tasks around prescriptions, and they would go into a queue, and nothing that the pharmacy intern or the pharmacy technician did could move forward without a pharmacist authorizing it. So I actually think that this is a great way to spread work and move it possibly, outside of a pharmacy, and to relieve the stress in the pharmacy. And for both the technicians and the pharmacists, I see it as a positive thing. And honestly, for the consumers, I think it's positive, just because we're putting things into a queue and nothing happens without a pharmacist approving it. So that's kind of my 2 cents. I don't see any hands up from any board members. So with that, Ms. Moderator, could you please open up the question answer, and so we can hear from the public on pharmacist interns and pharmacy technicians making permanent this waiver. And once again, the committee voted to put it on hold.
This is the
recommendation.
This is the moderator. We've opened that Q&A panel. If you'd like to make a comment on this discussion item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. Our first comment comes from Paige Talley. Paige, I've sent the request to unmute your microphone.
Thank you. Paige Talley with the California Council for the Advancement of Pharmacy, and I completely agree with Licensing Chair Veal that this is an important step toward allowing technicians and pharmacist interns to work from home. And I don't think they're any different than anyone else and would clearly want this. I encourage you to please allow this to go forward and not the motion that's on the table. Thank you.
Thank you, Paige.
Last call for comments. Seeing no additional requests, I'll close the panel.
Okay, and just to make sure that everybody understands the question and make sure there's no other discussion, let me just, is there any other comments? Okay, Nicole, I see your hand up. The floor is yours.
Hey, Debbie, I was wondering, because I kind of agree with both sides. I definitely agree we want to get the tech's input on job functions and things like that. But this feels like one very specific piece that would be really supportive with what's going on during the pandemic that I think would help tech feel heard and supported. Is it at all possible to pull those two things apart almost? Like we can move forward on this, but we still have the summit that works on the other functions and the other pieces. The second thing I wanted to bring up that I missed before, this is really helpful when you think about space issues and keeping people safe and distanced when you're dealing with, COVID and things like that. We actually utilize this for the techs by moving them around our clinic building to unoccupied spaces so that we could have enough space in the pharmacy to spread out and be safe. So there are additional benefits to this when you're looking at limited space and area to have people dealing with various outbreaks of diseases and things like that. So anyway, I'd be curious to know if we can think of the two separately instead of thinking of the two as being linked.
Yeah, so let me answer your question. Absolutely, the Pharmacy Tech Summit is going to happen. During that summit, we can discuss whatever we have, but these could be two separate items. We could vote, we'd have to vote down the committee recommendation and get a motion, but we could potentially vote to move forward with pharmacist intern, pharmacy technician waiver made permanent today and probably attach it statutorily, potentially with the pharmacist one. Regardless of what happens with this, the technician summit's going to happen. And honestly, probably regardless of this, this will probably actually be addressed, or discussed in the technician summit also. The one thing I want to make sure that these remote waiver situations are not just for pandemic type situations. Someday, God willing, the pandemic will be over and an emergency situation will be over, and these remote processing situations will remain. Is kind of what making it permanent. It will remain, and so we'll use it for other things other than just pandemic and, like you said, moving people around to be safe. So I just want to make sure that that's really clear, that after maybe that's not as important of a criteria, we would still have this to be used. Is making it permanent is what that would cause to happen. I just want to make sure that you understood that part.
Oh, yes, definitely.
Okay.
I would
Okay.
think that just the space piece is helpful. Like,
Yes.
we are at capacity in our physical space outside of the pandemic. We can't,
Okay.
we have nowhere else to physically go. So as we get larger, having people who could work remotely, including the techs, would be super helpful, that we don't have to try to build, a new pharmacy in one of the most expensive areas for real estate in the country. Do you know what I'm saying? Like, they solve other problems is what I was trying to point out. I know that doesn't apply to everyone, but if you're dealing with space issues in your location, this is helpful for that as well.
Okay, I appreciate that. That's a great clarification. Thank you. Cheryl, it looks like you have your hand up again.
Yes, and all I'm saying, what I'd like to say is that we're not saying that that this is not a good thing. All we're saying is that for sure we have this for 90 days, and there's no reason why the tech should not be able to just. This is going to be coming up pretty fast, and there's no reason why the techs should not have some input. We're not trying to, I'm not saying that we should take this away. I'm not making, I think what the committee decision was not to say that it's not going to happen, understanding that we are in a pandemic and we need it, and that we could possibly need it later, but we just want the techs to have some input. And I think we can wait and let them have that input because the meetings are coming up. So we're not saying that this is not a necessary thing, like we don't would not like the techs to not be able to work home and be safe. This is a not, because they're going to be safe for 90 days and we just want to get their input. Thank you.
So Cheryl, before you turn yourself off, I think that the challenge with this is the same as we did with the pharmacist, and that is, yes, we have 90 days from the end of the emergency, but then it will go away. So kind of like with the pharmacist, I think, do we need to make this permanent? Because even if we work on it to now and we get legislation passes, we're looking at January 2023. So we're probably going to have a gap. If we don't start working on it and moving it forward, we're probably looking at 2024, which means even a wider gap. So I'm hoping that you'll turn your mic back on, and I'd be curious around your comment on that.
My comment is, again, I really feel that we should have the technicians have a say on this, and that we should have those meetings. We were talking about these meetings last year. So I just think we should have those meetings as soon as possible, and that and we need to get that input.
Okay. All right. Thank you. Next hand up is Jig Patel.
I just wanted to comment that if we put it all together when it goes for a sponsor, then the process would be that much efficient, and we can move forward and take care of this problem that we have with not just tech shortage, but staffing and hiring folks. And this will just add more technicians into workforce and continue like it has been, whoever we have currently working remotely. If the pandemic ends, let's say in 30 days and 90 days, they cannot remote process, 5, 6 months from now, we are going to have a severe tech shortage. All these folks that are either disabled or cannot travel or any other reason that they are not able to go to work would be thrown out of the workforce. So I feel that we should move on it right now. And as far as the summit is concerned, I think it'll be great to hear everybody's opinion on what could be done, so and they feel supported and they could do more than what they can do right now. And if remote processing is, let's say, approved for pharmacist and technician down the road, a technician is not going to be forced to remote work process. It's going to be just another avenue for everybody involved. So, if somebody says, I don't want to work remote, then they will not work remote, right? So, and there will be jobs posted for specific, if it's remote processing work. So I think it's going to be more dynamic and the technicians are going to like this. I wished there were some technicians that joined, and hopefully we can hear their comments today too. So thank you.
Thank you, Jed. Kula, you're the next up.
Yes, so I'm modeling kind of the earlier discussion that we had, and I think this is something that should go forward, because if we have the legislative process where, we can weigh in on in terms of, how things are formulated, we can have the listening, we can get input from the pharmacy technicians at the summit, and also maybe have them provide input in the legislation, right? Since that'll be a public process. So I think we can still, I agree, we need to have pharmacy techs input in this. And I believe that we can do that through the legislative process and take the feedback from the summit and include that in the legislation.
Thank you, Kula. Song.
Oh, I was just going to say that it's just reiterating that, we need to focus on, yes, we are living in a different world, but we need to focus on what the California law clearly was before the pandemic. And we need to also be mindful that we're not trying to just, focus on we got to focus on the right thing of ensuring that the work is done safely. I understand the concerns of the pandemic, but we are fast tracking the pharmacist and pharmacy provision because of what it was before the pandemic world. This is a little bit different. So I just want to make that clear. We're not trying to solve the world's issues. Our focus is making sure that our pharmacy laws are consistent and that we have to understand those gaps may not be because it's actually not really was there. The gaps are something that was meant to be there before the pandemic. So there's a lot of layers in technician laws, legislative proposal in this world would be tremendously complex. And I really think we need to discuss further about it. The broader framework for pharmacists legislative proposal is on a totally different scale than a broader legislative proposal possibility for this law. Technician laws are so much more complicated and complex than a pharmacist law. So I just wanted to make that point before we go for the vote.
Thank you, Song. Is there any other board member comment?
I just had a question. I'm sorry, I didn't mean to jump. Cheryl's hand went up and I did not raise my hand. So Cheryl, go ahead.
Yes. Yeah, Cheryl, please.
Okay, no, I was just also saying that as for it's not. I don't see this as not allowing the techs to not work from home in this pandemic, and for the next 90 days, that's going to happen. But what we're saying, and in so much as those techs that have issues are not able to work, without this waiver, they would not have been able to work anyway. The problem is techs, we have a shortage on techs because, again, working conditions, and that's why we have the summit. And I think that just like the pharmacist speaking on working conditions, I think this summit is going to give the techs a chance to talk about the things that are important to them so that we can get more techs working. So I think that we should support the committee's recommendation.
I apologize for the interruption. Member Koenig has to depart temporarily, so if it's permissible, Eileen, I would request her vote before she goes.
President O, this is Eileen. If we're going to have additional discussion, then she can't really vote before because then she would have missed on some of the other discussion. So I don't know if you wanted to call for the vote.
It's okay. If in that case, we will hear. Yeah.
So why don't we only have one person left to say anything. Jig, can we call for the vote, or do you feel like you need to?
Yeah, we can call for the vote. I just wanted to
Let's
say
go
that
ahead and just call for the vote then, Song, and so we can try to get Kula.
Okay. All right. I'll just go with you first, Kula. How do you vote?
All right. So I know I'm trying to I'm trying to keep track. So I would like for us to continue and include the pharmacy text in the proposed legislation that we talked about earlier. And so if that's the case, is that a yes vote? Just making sure that I'm.
That would be a no vote.
Okay. Sorry, what was that? Be a no vote. Okay. So then I am voting no.
Okay. Thank you, Kula. All right. We're going to go back. We're just going to go with the order. Ricardo, how do you vote?
I don't know if you can hear me here.
Ricardo? Oh, I can barely hear you, very faintly. We'll come back for you, Ricardo. Nicole, how do you vote?
I vote no.
Okay. Debbie, how do you vote?
I vote no.
Okay. Jason, how do you vote?
Yes.
Thank you. Maria, how do you vote?
Yes.
Thank you, Maria. Jake, how do you vote?
No.
Thank you. Cheryl, how do you vote?
Yes.
Okay. Jose, how do you vote?
Yes.
Thank you, Jose. Ricardo, how do you vote? Sorry, Ricardo, I cannot hear you.
Now, I'm voting
yes. Yes? It's a close vote, so I want to make sure I get it right.
Yeah, I'm voting yes.
Okay, got it. Thank you, Ricardo.
Okay, thank you.
All right, I vote yes, the motion passes. All right.
Okay.
Send it back to you, Debbie.
Thank you. Our next item of discussion is discussion and consideration of requirements to serve as a pharmacist in charge. Just a little bit of background. Well, the background is in the meeting material. So let me just jump to the committee discussion. Kula, just not to call you out, but pharmacists and PIC we talked about a little bit yesterday, and so that's the pharmacist in charge. So they're the ones that.
Sorry, Debbie. Just for the record, I believe Kula has departed. She might be back at 12:30. Sorry, Debbie. Didn't mean to interrupt you.
I don't need to direct this at her. Okay. Anyway, so the committee reviewed the draft attestation. So that was kind of our what the board had asked us to do is to move forward and put together some sort of an attestation and potential training program for these pharmacists in charge before they are officially made pharmacists in charge. So one of the things that we did is we drafted an attestation that the committee reviewed and thought was appropriate and agreeable and wanted to move forward to the board. So before you became a pharmacist in charge, currently your employer fills out a form that says, we kind of basically nominate this person to be pharmacist in charge. Now the individual, the pharmacist in charge candidate, would also need to sign off and say this: I certify under penalty of perjury, under the laws of the state of California, that I understand and accept the responsibility for the above referenced pharmacy's compliance with all state and federal laws and regulations pertaining to the practice of pharmacy as required in Business and Profession Code section 4113C. Further, I understand it is unlawful for any pharmacy owner to commit any act that would subvert or tend to subvert the efforts of me as a pharmacist in charge to comply with the laws governing the operation of the pharmacy as provided in Business and Profession Code section 4330B. So we felt like this attestation appropriately encompassed a couple of the challenges that we have encountered with folks who were perhaps nominated as pharmacists in charge by their employer, that they didn't really understand exactly what they were accepting. So this states, exactly, I understand what I'm accepting, and they have a code section that they can go reference. And in addition, it lets them know that their pharmacy owner cannot force them to do anything that they think is inappropriate. And then, so we agreed with that language, and we thought that that was good. And in addition, we wanted to discuss what should be part of the training program for the PICs. So these are the 5 items that we thought should be part of that training program. Number 1, that we should review legal requirements for PIC and the Sternberg decision. Number 2, we should review legal requirements and the overview of the self-assessment process. Number 3, provide information on how to prepare for an inspection. Number 4, provide information around the legal prohibition for a pharmacy owner to subvert or tend to subvert the efforts of the PIC to comply with state law governing the operations of pharmacy. So that kind of goes to that last sentence in the attestation. And number 5, review the top violations that result in issuance of a citation and fine for a pharmacy. And part of this training is not to go over every little detail, but to, pharmacists are professional. We're used to being able to, if we're provided with the source, we'll provide overview information on each one of these things, as well as where they can go to get more information. If they want to dig in even deeper than the training, where they could go for additional information. We anticipate that this would be about an hour long, and that recommendation and the length of that came from the board staff as they thought about putting together a training program with these 5 items with that goal in mind. And so they thought an hour would be adequate amount of time to present this training. And then also we discussed, like, when do people need to do the training? And what we decided is the training would be required to be completed within 2 years of the appointment. So and our thought was, if I'm a pharmacist and I'm moving, whether it be in a chain between pharmacies or from an independent to an independent or a hospital, to hospital, whatever, if my employer changes or my employer stays the same, but my PIC assignment changes, that within 2 years, if I've taken the training, then I'm good. I can check that box. But if it's been more than 2 years, I have to go back and take the training again. Just because new things come up. We did not want to make the person do the training every time that they became a PIC at a new location, because sometimes that is less than every 2 years, and in some cases it can be, fairly quickly. So we thought that the redundancy was not necessary, except if it was beyond a 2-year period. And the one thing I kind of brushed over was, how often does someone have to sign the attestation that I discussed previously, and that our committee decided that the attestation would have to be signed every time a person is signed as a PIC or at a new location. So the attestation is every assignment. The training is only if you're taking a new assignment within a 2-year period. We did open it up for public support. And really the only thing that the public came back with was that we felt like this should be board provided training. So the board would develop and provide the training, and the public thought that we should have a board approved provision. In other words, an organization other than the board could provide this training as long as it met the board specifications. So the board would have to, either have guidelines or review their training to make sure. And we just felt like the board provided enabled us to be a little bit more nimble and change. But and so that's what the committee went with, is that it would be board provided training. And once again, the biggest pushback we received from the stakeholders was that they wanted it to be board approved. In other words, the board could provide it, but also there'd be an opportunity for others to provide it. So our committee recommendation is, as you see there on the screen, around the attestation, around the training and how often we have to do the training, as well as that it would be board provided training. And that we would, give the authority to the executive officer to make, minor changes to this rulemaking or regulation. So I think I have adequately, and this is once again, this is a committee recommended item. I believe the committee was unanimous on this recommendation. And with that, I'm going to open up for comments. Cheryl, you are number 1 in line. Cheryl, you're on mute if you're speaking.
Oh, I'm sorry, Deb. I'm sorry. I didn't realize my hands were up. I'm sorry.
Oh, okay, no problem. Nicole, you are next, number 1.
Thanks, Debbie. I really like this. I love everything that's included. My comment has less to do with this, but of a possible action after. This brings to mind, again, that idea of having maybe a pharmacist, like anonymous tip line or something if they felt that the pharmacy owner was violating something. I feel like that idea has come up a few times in the last couple of days. So just wanted to throw that out there, or giving resources for a pharmacist in charge if they felt that their employer was violating. How can they handle that? What can they do in terms of notifying the board? Again, not about this, just something we may want to think about after if we do this. Thank you.
And I thought we had a complaint or tip line that you could provide an anonymous comment. Don't we, Ann?
Yeah, the board can investigate anonymous complaints. There's some challenges with it, but absolutely can investigate an anonymous.
Thank you, Ann. Jig, Nicole, your hand is still up. Are you done?
Yes, I'm done. Thank you.
Thank you. Jig?
Yeah, Debbie, I just want to make a comment that, taking on as a PIC in a pharmacy and just not pencil whipping the self-assessment and really going through the training and knowing your responsibility is so very important. And I think this is a step forward in the right direction. So, thank you.
Thank you for your comment. I'm not seeing any other hands up from board members. So Ms. Moderator, if you could please open up our Q&A and we can see if we have any comments from the stakeholders.
This is the moderator. We've opened that Q&A panel. If you'd like to make a comment on this proposal, please click on that Q&A icon, type comment into the text field, and submit that to our panelists. Our first comment comes from Danny Martinez. Danny, I've sent the request to unmute your microphone.
Thank you very much. Danny Martinez with the California Pharmacists Association. Just want to reiterate my comments. We do believe that this should be board approved and not simply board provided. I know that during the committee there were concerns that perhaps the board may not like the tone of or the direction or the message of a training program if it's not in the firm control of the board. But I guess my response to that would be, well, the board has the opportunity to not approve that program if that's the case. I did make the comments that we are currently, as an association, working on this very issue, and we have resources that we've dedicated to this. We'd like to see this, part of the training program, if it's possible. We have a similar mission in mind, so we had asked the board to reconsider this and allow this to be board-approved training. Thank you.
Thanks, Danny.
Our next comment comes from Linda Panofsky. Linda, I have sent the request to unmute your microphone.
Panofsky for regulatory compliance with University of California, San Francisco. I just want to make a brief comment and also thank the board for this consideration, this training. I think it's definitely long overdue. And as someone who currently teaches pharmacy law, it's one of the most common areas of confusion for students and new graduates is related to a lot of the topics that you have here. I would just request that the board consider adding under one of the topics that is part of that new PIC training, a review of the disciplinary process and terminology, including something that provides guidance on the proper use of requesting office conferences. I know a lot of times licensees, especially new PICs, don't have an idea what the difference is between a citation with fine, a letter of admonishment, versus like more formal, disciplinary process such as a revocation and probation. So I think including that training would go a long way to help prepare new PICs. That's all. Thank you for your time.
Thank you.
And not seeing any additional requests, I will close the panel.
Thank you, Ms. Moderator. Song, I see your hand up.
Oh, I was just gonna request to go back one slide. That comment actually is a great comment, and
So
one more back.
no, it'd be one
Oh,
forward.
that's it.
It's actually B.
Oh. Okay. Do we not have it?
Maybe we don't have it.
Yeah, I think that would be a great addition, but I think
Let me read through the 5 items and let's see if it's and Anne, maybe you can tell us if it's somehow part of one of these 5. The legal requirements for PIC in the Sternberg decision, legal requirement and overview of self-assessment, information inspection, legal prohibition for a pharmacy owner to subvert, so that it's not that, and top violations. And the result in issuance of cite and fine.
And don't you think that could just be incorporated per your judgment on that one? I mean, I think that kind of could fall.
Could it actually be part of?
And I think item 5, it just kind of lends itself right there.
Yeah.
Yeah, and I would say legal requirements for PIC could kind of be including that topic in some way overview. So I think you can make that work, right?
Yes, I believe so.
Okay. All right. I will not say anything further then.
So Mr. President, Cheryl.
I was just wondering I do feel that it's important that the board does this. This is going to be a training. I know that I've done a training before, and it was from on a PIC with an inspector I had done at one of our offices. But I'm wondering if maybe later, as Mr. Martinez suggested, that maybe later, is that something we can look at a later date if CPHA or some other organization was able to also have, conduct the CE.
Yeah, that's a good thought.
Since this is a 1709 regulatory proposal, I would imagine, yes, we could change it down the road.
Yeah, I don't know if we can put it in your pullback file to maybe review this, like in like the recommendation of the board, and maybe that's I mean, that's not part of this vote, but I mean, do we routinely look at things like this, or would we need to specifically ask the staff to do that?
I think we can make a note to do post-implementation review. Absolutely.
Okay. Thank you. Mr. President, I do not see any other comments or hands being risen. So would you like to handle the call for vote?
Yes, please. Thank you, Chair Veal. All right, starting with Maria Serpa. How do you vote? Thank you, Maria. Jig?
Yes.
Thank you, Jig. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. Shirley? Shirley is not back yet. Kula? I think Kula is not back either. Ricardo?
Yes. Can you hear
Thank
me?
you, Ricardo.
Yeah, okay.
Yep, we can hear you. Thank you.
good.
Nicole?
Yes.
Thank you, Nicole. Debbie?
Yes.
Thank you, Debbie. Jason?
Yes.
Thank you, Jason. And I vote yes, the motion passes. And back to you. Almost lunchtime. Oh my God.
I've got two more topics, and I think they'll go pretty quick. So I don't know if you want to get done with licensing before we move into lunch.
Shelley, was it you? Okay.
Yes, Ms. Kim is back.
Oh, perfect. Shirley, do you want to vote?
Yes.
Okay, thank you, Shirley. All right.
President, this is Eileen. Was Member Kim available to hear the entire presentation on that item?
Good question. I'm not sure. Shelley, do you know when she was promoted? I mean, or Shirley, I guess. Sorry, Shelley and Shirley sound similar. Shirley, were you able to hear the whole discussion, or were you just...
I was just promoted probably a minute or two ago, so I didn't hear the full discussion.
Oh, okay. Well, then never mind. We will cancel that vote. Okay, thank you, Shirley. Sorry for the confusion. All righty. Back to you, Chairville.
Okay, so we're moving on to agenda item C, which is discussion and consideration of the renewal process for pharmacists and possible changes to consolidate all the CE requirements or training requirements into one place. So just as background, as part of a board's discussion on implementation of provisions of Assembly Bill 1533, it was recommended that the licensing committee consider updating the renewal requirements to consolidate the various CE requirements into one place, which I think is actually brilliant by the board. So during our meeting, we had a discussion and we reviewed a proposed amendment to CCR section 1732.5, which is a section for renewal requirements for pharmacists. And the members, I believe unanimously supported the change in language. And so as such, we have a committee recommendation. And I think in the attachments, you can see the revised language, but it's to initiate a rulemaking to amend CCR 1732.5 so we can do it by rulemaking of regulation. And I would work with the executive officer if we need to look at any language considerations. But basically, if you look at attachment 2, you'll see it just lists currently all the CE requirements from the various places in pharmacy regulation it just kind of condenses it all into one spot. So people can, as you're doing your renewal, you can see if there's other CE that is applicable to you that you should be doing as part of your renewal process. So it just seems like a very efficient thing to do. And, we're always looking to make sure that our stakeholders, and here on the screen, you can see exactly how we were proposing to do it. But I think one of our goals is to make sure that our regulations are not hard to understand and as clear as possible. And we believe that this is what this proposed regulation does. Maria, I see your hand is up.
Yes, thank you, Debbie. When we discussed this legislation in Enforcement Committee, I appreciate that the Licensing Committee took this forward and making regulatory changes. But as part of the discussion, we also requested that this be easily documented during the renewal process, whether that's online or a form, that this information be easily seen and checked off by the licensee during the renewal. So I just wanted to add that to the record.
Okay. And Anne, I'm assuming that would be something we could add to, I don't know, the renewal document?
Yeah, I think the hope is to update the form to include it as well as the online renewal process. I mean, it will require IT programming, but that's the hope.
Okay, thank you. All right, I do not see any other hands raised by board members. So Ms. Moderator, if you'd please open up Q&A for the stakeholders to speak. Or public, I guess I should say.
Our Q&A is open. If you'd like to comment on this motion, please click on that Q&A icon, type comment into the text field, and submit that to our panelists.
All right.
Seeing none, I will close it.
Yes, thank you. Okay, Mr. President, let me ask any other comments by the committee or the board? Okay, Mr. President, I'm not seeing any other hands go up, so can I hand this off to you to call for the vote?
Yes, please. Thank you, Chair Beal. All righty. Maria, how do you vote?
Yes.
Thank you, Maria. Jake?
Yes.
Thank you, Jake. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. Shirley?
Yes.
Thank you, Shirley. Kula's not back. Ricardo, how do you vote?
I vote yes.
Thank you, Ricardo. Nicole?
Yes.
Thank you, Nicole. Debbie?
Yes.
Thank you, Debbie. Jason?
Yes.
Thank you, Jason. And I vote yes. The motion passes. Back to you. One more before we go to lunch.
Well, this and then actually two, but I think both of them will be quick. Let's see. Item D, discussion and consideration of CCR section 1730.1 related to application requirements for advanced practice pharmacist licensure, including possible amendments. So once again, Assembly Bill 1533 amended section 4210 to alter the application requirements for advanced practice pharmacists, recognizing in order to allow for qualifications under a single pathway, if that pathway included completion of a second criterion, that criterion, the requirement, and eliminates the current confusing language. There was concern that if you met one pathway, and let's say it was a residency that had some hours with us, well, the residency is one of the potential requirements. You could check that box, but it was not clear if you could take those hours and use those to check the box for one of the other pathways in order to qualify for advanced practice pharmacist recognition. So that's what 1533 asked the board to provide clear implementation of the policy. And so it attached attachment 3, which I think is probably also on the screen. The committee reviewed the possible amendment and application requirements. And I believe this was another unanimous vote that we thought that the proposed language, made sense and was appropriate. We did open it up for public comment and we received none. So let me see if there's any other questions or comments from board members at this point in time. And can you flip to the next slide? I think that might have, yeah, there we go. Any comments from the board? Seeing none, I am going to ask Ms. Moderator if you'd please open up for Q&A from the public.
Our Q&A panel is open. If you'd like to make a comment on this proposal, please click on that Q&A icon, typing comment into the text field and submitting that to our panelists.
All right.
Seeing none, I will close it.
Thank you. And I didn't say this, but this was a recommendation from the committee or a motion. I think this is a motion from the committee, right, Ann? It says possible motion.
If you can give me just a minute, I was feeling the same way and now I'm questioning myself. I apologize.
No problem.
It is a committee motion.
Okay. So since this is a committee motion, we do not need a second. And is there any other questions or comments from board members? All right, Mr. President, seeing none, would you like to call for the vote, please?
Yes, please. Thank you. All righty. Maria, how do you vote?
Yes.
Thank you, Maria. Jig?
Yes.
Thank you, Jig. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. Shirley?
Yes.
Thank you, Shirley. Kula's not back. Ricardo?
Yes.
Thank you, Ricardo. Nicole?
Yes.
Thank you, Nicole. Debbie?
Yes.
Thank you, Debbie. Jason?
Yes.
Thank you, Jason. And I vote yes, the motion passes. Back to you.
Okay, for the last item is the review and discussion of our licensing statistics. I am not going to go through them all, but they are in attachment 4 in the meeting materials. The one thing we did briefly discuss is there are times when we are not meeting, we know that we are not meeting our processing times as we would like to. It is due to continued pressure with staffing, leave of absences, open positions, but Ann and her team are very nimbly trying to move people around to try to address the most urgent issues as quick as possible, and is keeping us in this situation in, I think, pretty good shape. Our goal is always to be current with our processing times, whether it be initial application or deficiency processing times. But so just want to acknowledge that, and also acknowledge the staff, and we know they're trying very hard to move and be adaptable and address the most pressing issues as appropriate. So are there any comments from board members on the licensing statistics that we have there? Yes, Cheryl.
Yes, this question is to Ann. In the cases where members send the money in time for renewal, but if they haven't gotten a response, but it shows that the money went out of their account, does that mean that they're okay? Or because I know it's taking time because of the shortage, or what does that mean?
Cheryl, typically if the money's been cashiered and it has not been updated, That tells me that there's maybe a problem with the renewal form. So the delays sometimes are when payments are processed by the central cashiering unit. Then it takes a little bit of time to get over to us to then look and evaluate what those holds were. So sometimes there's a bit of a delay there. But if someone's having an issue, they're welcome to email me, and I'm happy to do some research and have staff reach out.
Thank you, Ann.
Thank you, Cheryl. I do not see any other hands or for questions or comments by board members. So, Ms. Moderator, would you please open up the Q&A for the public?
We've opened our Q&A panel. If you'd like to comment on this item, please click on that Q&A icon, type comment into the text field, and submit that to our panelists. And not seeing any requests, I will close the panel.
Thank you very much. Mr. President, that is my report for licensing. Thank you.
Thank you, Chairville, and thank you for all the work you do and for the committee's work. Really appreciate your time and dedication. Okay, with that, it is 12:35. We will take a lunch break. I would say 1:30 p.m. if that's sufficient for everyone. If not, please say not enough. Okay, all right, we'll go to lunch. We'll be back at 1:30.